सतो मा सद्गमया तमसो मा ज्योतिर्गमया मृत्योर्मामृतं गमय ॐ शान्ति शान्ति शान्तिः। या कुन्देन्दुतुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा। शुक्लां ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदां जाड्यान्धकारापहा। हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्।
मुझसे नहीं होगा, मैं जा रहा हूँ। अरे रिलैक्स, सेफ है यार।
Good morning, Bali.
Good morning, sir. Good morning, sir. Nice to see you,
Very
sir.
nice to see you. Very nice to see you.
Yeah, sir. In morning, from 10 o'clock, we have 3 session today. Today 3 session we have, and after the 3 session, we have the validatory session, sir.
What time is this?
After the 3 session, we have 3 session today's program. Speaker session. Yeah.
Okay. What time the validity starts?
Validatory, it will start from 1 p.m., sir.
1 o'clock. Okay.
1 o'clock. I hope you will be present in the validatory session, sir.
Let us see. Yeah, let us see. If I have no other meeting, I'll come because there is
yes,
one
sir.
at 12 o'clock. But it will be on. I'm keeping the another laptop so that I can use that laptop for my other
okay.
purpose.
Then
okay.
Yeah, if you will present, I will be feel good, sir.
Okay.
Okay.
Okay. Thank you.
Thank you, sir.
Thank you.
Our validatory session की कैसे जैसे main session
Good morning, Patricia. It's very nice to see you. I think there it's in the evening now, right?
It is evening, yes. Thank you so much.
Yeah, thank you. Very nice. The talk is very interesting. In fact, I'm associated with the university almost 4 years. Now I'm at home now, but looking after as an advisor research. So your talks, most of the talks, related to the research is very important, particularly for the university, because university, there is a culture that they feel simply it's for an academic purpose. They feel that, research, they may not get time. They think like that. But, now the system has changed. Government is giving more force on research. So this sort of a talk is very important for the faculties. Even our faculties of the nursing department, even they are doing wonderful research now, because they get a lot of patients, and you have to have this sort of a within good publications. That is also needed. So many journals are coming out now. Many of the journals do not have any standard now. So we are also enforcing them to get published in a good journals having good impact factor. So what I found your topic is very good, and it will be very useful to the faculties. Thank you very much. Thank you.
Thank you so much.
Sir, thank you so much. We are in time now. I request the moderator to start the session. Best wishes, ma'am.
Good morning to one and all present here. I, Monica Lashram, welcome you on the third day of the first International E-Conference on Technique for Effective Dissemination of Scientific Finding and Quality Practice. Today, we have with us our eminent speakers, Ma'am Patricia Banderlo, on the topic Evidence-Based Practice and Clinical Importance. Ma'am, Patricia Bandeloop is a registered nurse, a clinical assistant professor from University of Wisconsin-Oshkosh, US. She has 25 years of experience at the bedside at Theda Care Medical Center Inpatient Obstetric Unit. Ma'am has coordinated and taught a multitude of community programs. She earned her master in nursing with the focus on education in 1993 and has continued to teach in the College of Nursing. Ma'am has expertise in a number of clinical and theory area, both face-to-face and online, including childbearing nursing, health practice to diverse population, designing and facilitating simulation in nursing practice, clinical nursing in obstetric and family and community nursing. Ma'am has been a delegate to several international conferences in India, including Sri Ramachandra Chennai, the Ministry of Health Conference for Strengthening the Nursing Midwifery Workforce for Improved Health Outcome in India, and Sada University, Delhi. Ma'am is a certified in inpatient obstetric and a member of AWHONN, Association of Women's Health, Obstetric and Neonatal Nurse. I request ma'am to take her time. Ma'am, it's over to you.
Thank you so very much. Why don't I just share my desktop? Okay. Are you able to see?
Yes, ma'am.
And you can hear me. Okay, excellent. Thank you so much. I'm gonna close that too. All right. I first wanted to thank you so very much for the invitation to participate in your esteemed e-conference, and I appreciate the opportunity to discuss this topic, and I hope that I can contribute in any way, and just to help you to keep the excitement going so that our research can continue in both of our places. I am from the University of Wisconsin-Oshkosh, and this is one of our campus buildings. And the reason why I put this one on here is two. One is that I wanted you to know that it was Nate here. It is now 11:37 p.m. and I am in my office on a Friday night. I'm very excited to be here. It is also very cold where I am, and our snow is just melting for spring. The nursing program, the college where I have been for almost 30 years actually, does have a multitude of nursing programs. We have probably 300 graduates per year or more within the undergraduate BSN programs, the Masters in Education and Masters in Leadership, and also the Doctorate of nurse practitioner, and we also have a nurse anesthetist, a doctorate program for nurse anesthetist as well. So an accelerated program, which is a bachelor's to BSN program that takes place in 1 year. Our college, our university opened in 1966 is when they graduated the first nursing class. And we have a good reputation and have had a good relationship with several colleges in India as well. Okay. My background, as we said, was in maternal child nursing. So I would like to just remind you that I know that the United States and India share many of the accomplishments and the goals in healthcare. We also share some challenges, but we also have different problems and successes as well. So I hope that I don't lead you in the wrong path or don't insult you in any way. I'm going to have to talk from my viewpoint. I haven't been in India now for like 8 years since this little baby was born, my first granddaughter. So our shared topic is evidence-based practice, and this is so exciting. We want to see that there are so very many benefits if we can have the best available information, and that it is not only beneficial to the healthcare practice, but very specifically to each patient. It allows us to use our professional judgment and give the best care. And as we went into our professions, that's what we wanted to do. We wanted to help people, and this allows us to help them the best that we can. It not only lowers the cost in a financial setting, but it also lowers the cost of time when we don't make mistakes. It lowers the stress level, and it increases the productivity of our patients who can get back to work or back to their duties. The research in pregnancy, though, is somewhat limited. It's very important, and it's recommended by the Office of Research on Women's Health and the National Institute of Health. So our NIH program wants pregnant women to be included as many times, but that does come with some difficulty. And without that, it does happen that maybe the pregnant women receive less care because maybe the research that we're finding doesn't apply to them. The evidence, can I help you? Okay. The evidence-based practice that we have ideally would be conducted on pregnant women, but honestly, they are excluded a lot, specifically from the pharmacology trials. And you can understand how this would be difficult because we don't want to obviously harm the fetus. We have many regulations that currently protect vulnerable subjects. And so going forward, we have to consider the ethics of our of our program. The Institute of Medicine has pointed out, though, that even with our best intentions of having the evidence that is best practice, we found that there is a lag between 15 and 20 years before the research findings are actually implemented in the clinical setting. This really seems unnecessary to be this long. It really seems that we are wasting time and opportunity to give that best care. So I want to explore that a little bit and see if we can offer some suggestions to make this happen faster and smoother. So one suggestion that's been made by the Royal College of Obstetricians and Gynecologists would be that if we're going to seek research for pregnant clients, one of the best approaches would be to first collect your eligible patients and participants and then approach them long before labor, so that if we wanted to study the process of labor or any controls or research in that area, we would want them to have time to have the information and discuss the risks and benefits, and that in labor, we would want to reapproach them again, find out if they continue to be interested, so that at least we have a baseline of understanding about what is the best plan to go ahead with this. And that is partially because of the challenge of being in pain. So this is more of is a unique setting. It's certainly not the only time where dealing with patients and trying to get consent is quite difficult, but it doesn't seem ethical if our patients are under the influence of opioids, or it isn't consent. They cannot give consent being in so much pain. So they also can't feel coerced that if they say no to the research study or the questions that we have, that possibly they would receive less quality care. So it is also important that we separate the research from the caregivers at that time, so that we would minimize that impression. There's also some concern about randomizing groups, because
excuse me, all the delegates, please mute yourself. Delegates, please mute yourself.
Thank you. Because we can't always randomize studies, because the caregiver or the patients really have their own preferences, and so they would find it hard to be put into specific groups that possibly would receive care that they weren't interested in. So this is all pointing to quality, which is really what we're all aiming for. And that means, obviously, you've been talking about this over the last couple of days, but the importance of safety and effectiveness, person-centeredness, timeliness, efficiency, and equity. And I want to focus on equity just for a minute, because specifically in the United States, I know that there is quite a bit in the news, and it is at front and center of our minds at this time, of the problem of inequality and how diverse populations are receiving care that is actually less than adequate. So I wanted to say that in this global health equality, that we find that countries who have low to middle income, that they're getting less care. And I think about the availability of, say, the COVID vaccine to the countries right now with less resources, say the areas of Africa, compared to what the United States has been able to acquire, and that continues into other resources as well, and that would not be equity but inequity, and that shows up in obstetrics in many ways, in the infant mortality rates, which in the United States our overall rate is 5.9 deaths per 1,000 live births, but yet our non-Hispanic Black babies are dying at a rate of 11.1 per 1,000 live births, and there isn't a good reason for that. We are looking at preterm, which is one of the things that's related, or one of the variables that seems to be related to the infant mortality rate. And the suppositions are that possibly this is related to cumulative chronic stress, related to the amount of racism that families are facing in our country. And that is, to me, is not acceptable. It's very, very sad, and I'm hopeful that we can make a difference, but at least talking about it is a very good first step. You'll see that it's woven into our system, and it's not just the moms and babies, but it's about a system who has been established on how the care decisions are being made differently for the patients who are not white. And that includes receiving less pain medications in an ER, for example, or being offered the specific surgery, which is the plan of care in general, but given if they're not men or white middle class men, specifically are at the top of the care, that the care is subpar. I thought that this was interesting if we look back at some of the information that at one time we were certain was helpful. And so historically, I look at some examples of IV mercury that was used for syphilis or wound healing. I think about radioactive water. You'll find that could be in chocolate or toothbrush or toothpaste for I don't think it's chocolate toothpaste. I think it was chocolate or toothpaste, and that would be for possibly mental illness. Narcotics and including morphine, laudanum, heroin, cocaine, given for colds and insomnia. And I've not heard of tobacco smoke enemas. I have heard of chloroform, and I know of IV alcohol that was given to our pregnant patients who were in preterm labor. And it was somewhat effective, but obviously not the healthiest choice for the babies. Rectal exams were done for our labor patients because the nurses weren't allowed to actually do those, the vaginal exams at one time. So these are some of the things that we thought was best practice, including at one time the thalidomide that was given during pregnancy for morning sickness, and we soon found that increased the risk for babies with missing limbs and other congenital issues. The DES babies, as they were called, this was given to prevent miscarriage for preterm labor, and what we have found is that then further generations were actually the daughters had 6 times the increase, 40 times, excuse me, the risk of carcinoma for the lower genital tract. So that is obviously significant, but we did what we thought was right at the time. And one of the doctors that I worked with would always say that when he went through medical school, he knows that 50% of what he was taught was wrong. And the problem is he just is still having trouble figuring out which 50% it was. So we did the best, but slowly but surely things sort out. So we have a process of the FDA that categorizes medications. And this is done with difficulty as well, because it's not possible, it's not ethical if we had 100 women that we would, pregnant ladies, and we would say, so we're going to, half of the room is going to get this medication and half the room's not going to get it. And that would be obviously randomized, and that would be great research, only not ethical to find out, what the effects were. So in this case, we're looking at animal studies, and this was first determined starting in 1890 and, or excuse me, 1980 and through 2000. And they decided that 91% of the medicines that we have are actually unknown or undetermined safety. So that falls into failed to demonstrate a risk. So that would be A. And then, but no studies that would also include B. Then we have 3% of the medications that have shown some fetal risk. And then that left 6% of all the medications that are in the drug books to have no risk. So actually, so I had that upside down. So no risk, and then positive for evidence for the reactions. So basically the biggest group is what we don't know. And the other thing is, if we're using this based on studies with animals, we actually don't know if those results can actually be then attributed to, or excuse me, those results can carry over into the human subjects. At this time, we certainly don't know. I mentioned pregnancy and lactation in the Food and Drug Administration, but through the professional societies, they do recommend this book instead if we're looking at the information specific to pregnancy and lactation, knowing that the metabolism, of pregnancy is quite different than the not pregnant body. So at one time, we thought that babies were protected on the inside so very much by the placenta that it was a impenetrable barrier, and that if a baby actually did show some type of a negative effect from a drug or an exposure, they would call that a leaky placenta, like the exception to how a baby or how a response took place. And so it took a long time to recognize that what does cross the placenta and how babies are not behind a solid wall. The quality, no financial, this would be the call to those who are prescribing care. In the United States, we don't have a system that anyone can receive any of the care. They don't get free medications. And so what we have to do is try to understand the cost to the patient of the things that are required of them. It's the thought that a third of the procedures, the medications are thought to possibly be wasteful. And there's a program called Choosing Cares Wisely, and it has a whole list of procedures that are no longer recommended as our evidence-based knowledge or knowledge base has come around. And if we want to optimize care, it's our responsibilities to know what's on that list. And I know what's on it for OB, but I'm very not knowledgeable about what it would be for the medical surgical procedures or the cardiovascular procedures. But please feel free to check out Choosing Cares Wisely if you haven't heard of it. I think it was just interesting. we want to, again, optimize the care for our families. So we need to know and recognize who can afford food before we would ask them to take frequent follow-ups to the clinics and follow-ups to that are possibly unnecessary, and that they don't have the time to get off of work or the time to travel, or who's going to care for their children. So it's not just about the finances. It really is about the entire situation and looking at it holistically. So again, I remind you that we want to celebrate that it's that evidence-based practice. It sounds so great. Remember why we're doing it, and it's exciting. We want to help others. So one example I have came to me when I was probably a new nurse on the floor, and I had actually started teaching childbirth education classes as well. And I saw on TV, I saw on the newspaper a headline that said, "Ambulation in labor does not benefit laboring patients. It doesn't benefit their progress." And this was in a not peer-reviewed journal. It was just a lay journal. It was in the newspaper and just smaller print. But I was very concerned, because I knew that that it couldn't be true. As a labor patient, thinking about the importance of moving around, I've always encouraged that to my patients, that it gives them a sense of control rather than laying in a bed. It helps the baby to move down through the pelvis and make the turns that it has to make during labor to reach the introitus. And one of the ways I have always thought about it is that if moms are moving around, it helps to wiggle the baby out. Not everyone says it that way. And I thought, well, did my students see that? The families that I was teaching childbirth education to, did they see that it wasn't important for them to move around? And if their nurse was encouraging them to change positions, that was this going to be a problem? So I went back to the original article, and it compared two groups. One group, the control, was allowed to be in bed. They could go to the bathroom. They could be in the chair. And then there was a comparison group that was allowed to ambulate as much as they wanted to. They could walk at least 20 minutes. They were encouraged to, but actually most of them didn't. You'll see that only 40% walked 20 minutes, 40% were less than 20 minutes per hour, and 20% chose to actually not really get up and walk. So I'm looking at this critically, and I wondered, how did those mothers get to the toilet, and how did they get to the chair and back to the bed if they weren't ambulating? And so the sample was small, the sample was not valid, and or the sample was not random, it was small. And so I thought that I didn't think that this was actually going to help. What were the results? Did we have less assisted deliveries? Did we have, how was the length of labor? And it said that there was no difference in the benefits, but it didn't say actually what everything was. So it's not the researchers' fault. It was that somebody was looking for a headline and made inferences, not looking at it critically, and the results of that, I believe, really could have been harmful because of having, like I said, an incorrect interpretation of a situation. So from that moment on, I knew that I had to go back to the original articles, and that I couldn't take things from a headline. So I thought, okay, well, now it's important that I would know that if we had something that was a valuable, that was randomized and repeated and big samples, and that it was reviewed to be high quality, then I would understand that I would want to change. And so to look at change, I think that that's partly or maybe mostly looking at why does it take 15 years to apply the evidence to a new situation. And I think that part of it has to do with the sense of loss. So we have to be strategic in our ways of changing, looking at it from ourselves and looking at it from our peers or my students, for example. And so sometimes we have to think creatively. One of the questions that I've had along the way, it may not seem like an important topic for looking for evidence-based research, but it has been for me for a long time, and that's newborn bathing. So in the United States, it's very common for the nurse to help participate in the newborn's first bath. That it usually had always traditionally taken place within the hospital ever since babies were being born in the hospitals and from home births. So that was 100 years ago, and so we looked at baby baths. And when I first became a nurse, the sponge bath was the standard of care. And we would put babies, on a countertop on a waterproof pad and unwrap them just a little bit at a time and clean that part, cover it up, and clean that part and cover them up. And babies didn't care for this method at all. But parents were, I usually ask them to take 2 parents at a time, just so that if they needed any supplies, they could, get them. And then we had some research that said a tub bath would be more effective. And so some of our nurses thought that would be a great idea, and we would put babies, we'd actually submerge them all the way up to just our face, remaining out of the water, knowing that babies have been in the water for a long time. And so if we wait and after the baby is breastfed and the baby is stable, that if we put the baby in the water, that they would lose less body heat, that it would be less stressful, and therefore their blood sugars would not be compromised as much, and that being less stressful, it also maybe was better for the breastfeeding. And now there's a new method called a swaddle method, and that one they're saying also should be delayed. And I understand this as well. And they found that if we waited for 24 hours, and I know that in India, it has been my experience that babies weren't bathed within 2 hours after they were born. But that was really kind of a standard of care for many years, that usually after 2 hours, 4 hours at the most, the baby would be bathed. And now the standard says, well, let's wait 24 hours and let's see what happens. And it seems that the breastfeeding is going better. Mothers and babies are appearing to be less stressed. But I'm still wondering about the skin barrier, the vernix that's on the babies, and do we wash that off? If we do, is that a problem? Where I know that again in India, many of the places that I've been, we would just allow that to soak into the skin, and that seemed like a great strategy. It seemed logical to me as well. And as I said, this doesn't seem to be a big issue, but it is, because babies who are cold, babies who don't breastfeed, mothers and families who are stressed, this can be, have a lot of implications for the new family that's, just starting out. So I'm looking for evidence-based research, and I'm not finding it. And if we did have it, I would be so excited. It would be so great. So as a professor, I also, as I said, I'm teaching in the university setting for almost 30 years. And I have absolutely tried to enforce and help students to have a beginning understanding as I work with the first year students, and that I want to carry that out through their nursing career, so that as the senior nurses, nursing students, they would have projects where they would actually present and focus on a research article that was supported by the practice, the practical clinicals that they were doing. And so this was something that isn't new in any way. This has been going on for a lot of years. So I know that we encourage evidence-based practice. We talk to them about sustainability. And for that, I go back to that statement of, how come it changes? How come the truth was, this is how we're going to do something, and then the truth is like, no, they're not going to do it that way any longer. So in school, we have case studies. So I have an example here of an activity where I would ask them to help me figure out what level of research is this. If we have a randomized controlled pain intervention study to test the effectiveness of relaxation training preoperatively on postoperative pain perception among female patients undergoing outpatient laparoscopic gynecology surgery. The patients from the larger gynecological practice were assigned to usual pre and post-op care, or to the group where they were going to be trained in this exercise. So the exercise was actually one-on-one introduction to relaxation training during the pre-admission interview, and then there were audio recordings and exercises that they could also use post-operatively. So then we're going to look at the ratings of pain intensity in the postoperative period, and these findings suggested alternative approach to managing pain preoperatively was positively affecting the postoperative pain. So what level of research? And as I look at this one, I remember that this was not randomized, right? It was this was randomized control. So we have some sense there. We have variables present, but not possibly, what was I going to say? We have many commingling variables as well that I think could have been in there. So I don't know what you would think, but I thought maybe 3 at best. But it's just a place for conversation to look at and to, like I said, examine more curiously. So again, within the healthcare students, I want them to be able to look at the research. These are very much the same things that we've been looking at over the last couple of days, to review again the courses that they have, and groups. They had actually 12 extra hours. This was actually a research study that was done, and they had 12 extra hours of training on evidence-based practice. And at the end of a semester, at the end of a course, both groups actually improved, but there was a significant difference in the group that had the extra training. So I think that having more rather than less focus, it does seem to be valuable. But does nursing faculty have the knowledge to teach this? Well, some of the studies that are out there for faculty, it seems maybe they do lack some of the knowledge. So we have to ask ourselves as professors and instructors who've maybe focused on, learning the side effects and learning the nursing care approach, that we haven't focused as much on research, that we need to do that so that we can reinforce the value of the actual clinical skills that we're doing at the bedside. So there are tools out there for students and faculty to self-apply rate themselves on their abilities, and that could be called the ACERI tool. You might want to look that up if you're interested. And this is my examination of what happens at the bedside or on a nursing unit when something is going to change. And I wanted to apply Patricia Benner's novice to expert model, which I always like. And then the novice on the right here is my second grandchild, but she's wearing her mask as she's helping this teddy bear to a better life. When I think of the novices, those are the people who are just getting their first job, or they're even in nursing school. They know the rules. They have kind of a checklist, and they're just trying to get everything done. And to put in a new evidence, a new procedure that has this evidence-based label. And so maybe it's the bath one that I said before. Maybe we're going to suggest that they learn how to do something differently. And they're probably quite confused because their teachers told them not to do it that way. And so their teachers knew everything. And now why would they want to do something different? So they question it, they fight it. They're too busy focusing on learning all the other rules and the information they have to do. I would think that the advanced beginners also who are new and are still looking at some of the why questions and some of the organization, but are still having trouble there. They're open to new ideas, like they want to watch somebody else to start an IV so that maybe they can get another pointer on how to do it best. So they're open a little bit, but if we put something new in there, that is going to slow them down a little bit, and maybe they don't want to change it. For those who are competent already, they are organized, they have a plan, they're feeling more confident, and if we put a new procedure, they have to stop what they're doing. They have to change things, and it's going to slow them down again. And they were liking this part about getting more comfortable. And somebody who's proficient has a sense of confidence so much that that they don't want to change, because they're going to have to go back to that feeling where I really don't know how to do this. I really don't know what to do. And that feeling scares some people. I've seen it a lot where I have maybe a nurse that I know who's working in a specific area of nursing, and they've always wanted to work somewhere else and try a new, this whole new area, but they don't want to switch because, well, I'll have to start over. I don't want to do that because I have a little bit of seniority. So I know that changing has different reasons for yes or no. I know that the experts who actually know what the rules are, but they know actually probably also how to break every rule, because they use a lot of intuition and they know the value of things. For this group, it's sometimes difficult too, because they feel like they knew better. Whatever it was, I don't know, but they know better. So back to our clinician at the bedside. I know the policies, I see the issues. I am resistant to the new ideas. I see the lag. This is really what I have seen as an OB nurse, as a labor and delivery nurse, as a mom and baby nurse. My staff are great people, and and they are intelligent. They want to do the best care. So why is it so hard to change? Well, I think that it's because change involves loss. And looking at the change theories, remember step one is probably the most important. And that's the part about unfreezing. That's the part about letting go of what we thought was so important. And then the change comes, and then we can refreeze into a new way of doing something. But this part about unfreeze or de-implementing something really is difficult. But if we knew why it was being done, maybe it is ineffective or it is harmful, those make it easier to make the changes. And so again, I would suggest maybe looking at the choose wisely, maybe looking at the whole process here. Often research recommendations are ignored. I'm going to return back to that thought in a second, but I also wanted to tell you that as an instructor, one of the questions that I face is how within my textbooks, you can look at this. This is a pharmacy textbook that's going to be coming out. It's dated 2022 already. And so this is only March of 2021. And this book is maybe not available today, but it will be very soon. So the information that's in my textbooks who have a copyright date that seems very current have actually included the evidence, but not from today. Was it from a month ago, a year ago? Do we have the new improvements in our textbooks? We have to look at the new research that's out there. We have to keep following the evidence. And then for testing purposes, it's difficult to test on the new thing or the way that they're that they were taught in their textbook or that they were taught in the new way. So I have to already implement changes as a teacher. In our change theory also, I truly want to treat my students as adult learners. And I know that like the theories of adult education mean that I have to look at the socialization that goes along with it. I want to allow them to work together on my staff. I want the students to work together. I want them to be able to acknowledge the barriers that you'll see. I want you to also know that I believe strongly in the Noel's suggestions of having students, having the nurses on the floor, the nurses at the bedside, to be able to get their results early, for them to get their get their questions answered early. And so involving the nurses in the change is really important. I also want to involve faculty, and we have faculty that works at our university with our local community hospitals, and it's a great relationship. I know that I have clinical nurses who are working on research for those at the university, and it's a great partnership to see. But we also need administrators who are also going to support this. And as it was kind of mentioned in the beginning here, that it is sometimes difficult for professors to have their assignments in teaching and then being able to get enough time to do the research that they can. Our university is getting better at that and does allow credit differences for people who are doing research. So administrators need to be supportive. So evidence-based practice, my first thing is for you to remain curious. I wanted to say to get curious when you have questions, when you see things that maybe could be done more efficiently, or maybe could be, we should look at, ask those questions and look at the knowledge, apply it, assess it. You know, we have to follow through with, after we made that change, look back at it again and make sure it was the right change for us. So all in all, these changes do take a lot of time. So in practice, it's not only the knowledge and not only the skill, but it is an attitude. And by looking at this today and for allowing me to talk for a little while here, I hope that you see that being open to change and being keeping the patients in mind and the outcomes instead of our habits, that our attitudes are really important. So I want to thank you for your time. I wanted to also tell you that this is my contact if anyone ever would wish to ask me any questions, and my telephone number. You're welcome to text me there as well. The reason why I have this relationship with India is, I would say, is that because I was able to bring clinical students into your country and do community health. We had community health opportunities to work with the campus at Sri Ramachandra, and also with other campuses throughout India. And I went into houses with my students. We did assessments, we did teaching, and it has been just a great opportunity to share that we're all on the same page. We're all trying to do the same thing. So back to the same reasons remain. So these are my sources and my sources and my sources. And do you have any questions or comments as I am finished with my talk this morning?
Thank you so much, ma'am. It was indeed an informative session. We are really, it was really interesting to see the scenarios and experience that you have shared with us. We are all enlightened with your ideas and thought. Thank you so much, ma'am. Moving on to the discussion, ma'am, one of the delegate wants to know the difference between the traditional research and evidence-based practice.
We have to look at all of the criteria for evidence-based practice. One of the things is that, can it be repeated? Is it randomized? Is it, a big enough sample size? There are lots of criteria in that way, and in different areas, because we want to know if it can be applied to something else. But generally what happens is I look to Cochrane and some of the other databases who are able to take multiple studies and can compare the sample sizes and the results, looking at the methodology very critically to make sure that something isn't missing in there. And I think that that's a real important factor there in having the multiple pieces of research looked at. It generally isn't established by just one study.
Moving on to the next question from S. Vijay Lakshmi. What are the existing evidence in midwifery nursing?
Well, actually, we don't have a midwife program where I am. It's a little further away, so I haven't worked with the midwives, and we don't have one in our campus either. So my practice has been as a labor and delivery nurse, would be I don't know how to, I've always, the way that I'm able to manage the birthing process is that we will stay with our patients and help to guide them through the process. If we have something that needs to fall in the scope of practice with our doctors or our midwives, then they will intervene and offer guidance that way. But I would not call on them until the delivery, actually. So they manage much more of the pregnancy and then come for the delivery. So as a labor nurse, I don't actually conduct birth, but I am there obviously for the support of the team here. But I don't know where to go, because I do read some of the nurse midwife I guess I know some of them. One thing would be that for shoulder dystocia would be like the suprapubic pressure instead of the fundal pressure. That was one that actually originated from midwives in the evidence base, and also the hands and knees position is really strong with the midwives as well. That makes sense?
Thank you so much, ma'am.
Okay, and delayed cord clamping, I think, is a good one too.
Excuse me, may I speak something? Hello,
Yes,
good
please.
morning. Yes,
Hello.
Yes, ma'am, please.
I really,
Good morning.
Pat- Patricia, I'm so impressed by your presentations. So down to earth, and what actually we are seeing in our day-to-day life in the clinical area. Exactly the same presentations I could find in your study. And actually, I have learned quite a bit of new things from your presentation, and I'm going to share with my students and in the
Well,
future.
thank you so.
Really impressed and so happy to see you at least online.
Thank you. Thank you so much. I appreciate the invitation and I enjoy being here as well. And I would love to come back to India and have another conference where we could be together and share some tea.
You have explained with example that evidence-based practice, isn't it? And it was really evidence-based. But in India, recently a concept is arising, that is practice-based evidence. Because so many things we don't find in the literature. And so those things, while during our practice itself, so many issues are arising. And those small clinical studies, if we do it ourselves, we ourselves can generate evidence.
Right. Right. So if they get published and then they can get compared, it will create that evidence that we're looking for.
That's what nowadays people have started calling it practice-based evidence.
I see. Uh-huh. Okay.
And quite a few nurses are saying, if that is so, we are very comfortable, because so many people generally do not know what we do, and so many things are not available in the literature. No, because either people do not publish or those areas are unexplored.
Yes, yes, we have many.
Yes, that's true.
Oh.
So namaste.
Namaste. Thank you so much for the very kind words. I appreciate it.
Thank you. Thank you.
Thank you so much, ma'am. Now I request Professor Dr. Tumoni Konwar, Director Research and Outreach, to say a few words.
Good morning, all the delegates and our very known research person, Madam Patricia Vanderloop, who has given a very beautiful presentation. Madam has made it so lively with the examples. Examples are also so relevant, and beautiful research articles has been cited, and ma'am has worked out so much, and from her reference we can make it out. Thank you so much, ma'am, from our core of heart. And hopefully we will be able to see you personally in India, or you might invite me also.
Please come.
Okay. These days we are shutting, but not able to see each other. It's a very beautiful moment to see you and interact with you. Hopefully in near future also we'll be interacting once again. Now, once again, thank you so much. Thank you. Namaste.
Thank you.
Now, moving on, I request all the delegates to mute your mic. Now, moving on to the next session, I hand over the next session to Ms. Monica.
Ratna madam, good morning.
Good morning. So nice to participate. And I am very unfortunate that I could not do it from the beginning. And I have
Ma'am, we have 167 participants in the Zoom, and we have another same participants in the YouTube link. So total participant we have 390.
It's real great.
Thank you so much, ma'am.
That itself shows the quality of your, whatever you are doing there. All the organized.
Thank you so much, ma'am. We'll start your session, ma'am.
Yes.
Morning, ma'am. Good morning, everyone present here. Today with us, we have our eminent speaker, Professor Dr. Ratna Chakrabarti Prakash. So, ma'am will talk about the utilization of research findings. So, ma'am has completed her BSc in Physics from Calcutta University, then MSc in Mathematics from Calcutta University, then BSc and MSc Nursing from CMCH Vellore, Madras University, PhD Interdisciplinary Education and Preventive Health from Manipal University, then Diploma in the Rural Development from IGNOU, Distance Education, then PG Diploma in the Higher Education IGNOU from Distance Education, then Diploma in the Informatics from New Delhi. Madam has started her career as a staff nurse in CMC Hospital, Vellore, Tamil Nadu, subsequently worked as a tutor in Nursing College, CMCH Vellore, lecturer in the Nursing College, Annamala University, Tamil Nadu. After MSc Nursing, after MSc Nursing, departmental supervisor in CMCH Hospital and lecturer in Nursing College, CMCH Vellore. Professor and Dean in Nursing College, Manipal University, Manipal, Karnataka. Professor and Principal in Nursing College, Swami Rama Himalayan University in Dehradun, Uttarakhand. Professor and Principal in Pal University of Nursing and Medical Sciences, Uttarakhand from August, designated May change as the academic director. Then, Madam is a certified quality management representative of ISO, Manipal University, member of Infection Control Unit, CMCH Vellore, member in the Department of Medical Education, Manipal University, member in Board of Studies in Nursing in 5 Indian University, then adjunct professor in the School of Nursing, USA, then master trainer, HIV and AIDS, tuberculosis care and control and prevention of competency and capacity building of healthcare professionals. Then PhD nursing, research guide in 5 Indian university, 13 students already completed PhD and 4 are pursuing in different universities. PhD in nursing examiner in 7 Indian university, then scientific paper presentation and invited as a speaker in 41 workshops and conferences in India. Organized 30 professional workshops and conferences. Madam is a editor and contributor in 3 textbooks, Clinical Education, Research and Statistics, then authoring textbook, Patho-Psychological Implication in Healthcare and Nursing Administration and Management, then peer review in advisory board member, and 3 Indian professional journals, publication in 29 professional research and competence article in Indian journal and international journal. Madam has been awarded as the best clinical nurse in CMCH Vellore. Now I request ma'am to open her session. Ma'am, it's over to you.
Thank you very much. It was actually, I have never compiled what all things I have done in my whole life. You have presented it as compiled matter. So I myself am surprised. But nothing is my credit. It is my opportunity to work in very eminent institutions and my teachers and many great people who have come, who I have come across and learned from them. And whatever I learn in my life, I try to share with others, my colleagues, my students, and others, whoever is willing to learn. So nothing is my credit. Everything goes to the great nursing leaders who have helped me to learn whatever I know today. So these are very great people. And also I have learned so many things from my students. Right from UG students, ANM, GNM, BSc, MSc and PCC, all of them, and also my doctoral students, I myself have learned at every stage of my life that interchange of knowledge, expertise, competence, whatever it is, that has enriched me in very, very great way. Thank you very much for giving me an opportunity to be with you in this learning session. Thank you very much. So may I share my slides with you all?
Yes, ma'am, you are already allowed to share your screen.
Thank you. Thank you very much. Okay, so I was told that utilization of research findings. I have to share with you whatever I know about it and whatever I have experienced in my life. Now, I know all of you, I mean, I hope you are not afraid looking at the list of the areas I'm going to present. In between, you can always stop me. If you are bored, I know it's almost lunchtime, all of you are hungry. First, little bit we would see paradigm shift in nursing research, how we have shifted our focus from time to time. And that's how our nursing research has progressed from ancient time till today. Nature of utilization of nurse study findings. A few Indian nursing research studies we'll see. After that, we'll analyze all those studies to see what type of studies, whether it is utilizable or not. Then a little bit we have to ask ourselves, why do you do research in nursing? And research utilization versus evidence-based practice versus practice-based evidence. There are lots of confusions. And then another area is that factors facilitating utilization of research findings. And at the end, let us think together, where do we start? Hello friends, are you with me? Hello? I can't hear you.
Yes, ma'am, we are with you.
I'm with you.
Okay. I just wanted to make sure.
We have
Because
put
this is
mute.
lunchtime. Okay. Hello?
We have put them mute, ma'am, so they will be able to send you message on chat box.
Yes, yes. And also they can put up the hands. Okay. Now, nursing research shifting paradigm. Now, changing focus of nursing research had started from ancient times. To ensure people's health. Another is society, another is physician, another is nurse. And at the center is people's health. Now, internet connection is unstable, it's showing. It's okay, can you hear me?
Yes, ma'am, we can hear you. You are very much audible.
Okay. Now, in those Charaka Samhita and Shusruta Samhita, they have written that nurses are on equal footing with the physician, with the drugs, with the society. So these are the four pillars to ensure that people are healthy. So there, during ancient time in Vedic literature also, it is mentioned that nurses have participated in drug studies, herbs and roots and all, which are useful for what? Nurses have participated. And also nurses have participated in hygienic practices and how it is interrelated with health. Later, romantic era in nursing research started, where the people started developing theories and models. That is the connecting the variables. That's how we do in hypothesis, isn't it? Then curriculum development, forward vision. In curriculum also, nursing research was placed so that people are aware of the importance. Hospital care protocol development started where the nursing care had to be stabilized. Otherwise, each one is doing in different way. And that's how protocol development started in another era. Community studies were for expansion and extension of nursing care. Then health behavior studies were qualitative attributes of health illness continuum, like behavioral changes research for community health nursing. Excuse me, please. Sorry. After that, deductive and inductive outlook. These are all abstract thinking from so many broad type of focus, very broad type of area, broad areas. We bring down to a particular focus. Then research of researchable. That is what there we come about the utilization of research, nursing research. Today's nursing, how did we come here? The evolutionary process of nursing has been in many phases corresponding to the contemporary health needs of people. Like nowadays, corona has become one issue. So that there are so many nursing studies, nursing research are there on about corona. So as the health status of people have changed and people have become more and more aware about health needs, the nursing research also has changed its focus from time to time. In its genesis, all of you know what is genesis, that's the origin. Nursing had a strong foundation on practice. Till today, actually learning by doing, that has so much emphasis for our undergraduate like first year students, isn't it? So we have that practice session in the lab of procedures. Till today, most of the places emphasis is on learning by doing. That actually blocks the thinking. It is only imitation. Then came the curriculum era, emphasizing on knowledge base for standardizing nursing practice. Actually, evidence-based research, evidence-based practice started from there. The research era followed in search of new knowledge in nursing. That's how the body of nursing knowledge got strengthened and nursing profession became actually accepted, got acceptance as a profession as such. Because nursing has its own body of knowledge. So it is a profession. The theory era was the natural outgrowth of the research era because the interrelationship, that is hypothesis, among the emerging knowledge fields became very intricate or difficult. So theory construction actually, it made nursing leaders aware of the need for change. Change in education, change in research, change in practice. And that's how the nursing research has come a very long way from its origin, that is practice, till today. Today it is thinking based, that is the knowledge base. Now, learning by doing, so I have just put it in a flow chart, what we have seen so far. Then that led to knowledge base in the practice, generating new knowledge through research. Then need to find interrelationship among these units of knowledge. That led us to theories and model building. But 21st century nurses, we find ourselves at a crossroad. You know, every city or villages, there are crossroads, isn't it? We don't know, middle of the road we stand and we don't know which side to go. That is the crossroad. Now we see in this very simple way I had tried to put it. We are having one medical super specialization of nursing categories. Like we have medical surgical nursing, pediatric nursing, community health nursing, psychiatry nursing, and what is one more? OBG nursing, that is OB and gynecological nursing. Actually, we teach our students holistic health, but our curriculum is medical model oriented. That is the disease oriented curriculum. But we are teaching holistic health. There comes the contradiction. I'm teaching something, I'm learning something, whereas my curriculum says some other thing. So that is one area of confusion all of us we are having. The difference between medical diagnosis and nursing diagnosis, all of you know, in nursing process, we have one important step, that is nursing diagnosis. Medical diagnosis says, they describe the nature of the illness. Whereas as a nurse, I see the effect of illness on the individual, on his family and his community. So our work is more extensive, more in broad areas, and also our understanding of the patient's need or people's need is very, very deep. Whereas our curriculum is contrary because that is disease oriented. So that is one confusion we have. That's why we are at the crossroad. Another confusion is there. Right side, if you see, nursing rigidity. Nurses, in general, we don't like to change anything. Even Patricia also has mentioned that somewhere, that we don't want to change because there's a loss of so many things. Loss of comfortable position. People will not, if I change, if something is changed, I may not have the same recognition from my nursing fraternity. Another thing, teaching learning methods. Teaching learning methods are so traditional, and we learn so many things, but we have only one lecture method. Lecture come demonstration, that's all, usually. But we do not explore new areas of teaching learning methods on the basis of what I am teaching. That's why our students are not motivated. Then classroom versus clinical hours demands. Now, many people call us theoretical nurses because lots of time we spend in the classroom. Whereas, suppose I am teaching one particular unit, same particular unit, if I take my students to the clinical area so that the theory and practice transition is easy, and also because there is connection. Though I know that all types of patients will not be available, but still I can do simulation. That is why nowadays OSPI, OSCE, those two methods of evaluation is being utilized for teaching learning as well. Left side, if you see, people's health awareness is increasing because whether educated or not educated, they are highly aware about the health. Advanced technology has added to their awareness. Hospital policies for nursing is still ancient. In hospital, our hands and legs are tied up by these hospital policies. We actually independently, even if I want to do research, facilities will not be available for me. When I talk about facilities, you all know there are 6 M's. That is man, money, material, minutes, methods, and milieux. All the 6 M's will not be available for me if I want to do independent research in the hospital. Because hospital policies about nursing is so ancient, which has not changed because people really do not know what we are learning, and they do not want to know also. So because of all these reasons, nursing is at a crossroad, though we are in 21st century. And nursing research progress has been affected because of this confusion. Now, but there is survival of the fittest. If directly I am not able to reach a place, I will try to reach in different way. So we need to link up all these individual entities to get most out of this natural phenomena through theories and models. That is why present focus in nursing research is developing theories and models and testing those. That leads to evidence-based practice as well as practice-based evidence. In some areas, they are generated. So far, is it okay? Are you bored? Hello, Nimali?
No, ma'am, it is not bored. It is very nice. Please go ahead.
I mean,
Very good.
People who are attending there, is it okay for them? Am I going, too complicated or too fast? Is it okay?
We have receiving message in the chat box. It is very interesting.
Okay, thank you. Now, nature of research utilization. Coming to this, there are 3 ways. One is that conceptual or indirect utilization. In this, the study findings can bring changes in thinking, but may not have any influence on behavior. Because always what is practice? I think something which I convert it to action. But this type of indirect utilization, some of the studies, they will make me think, but I may not act on that. Like presently awareness about prevention of corona by following the government guidelines. But how many people are wearing masks? No, following social distancing. All these things actually not possible. Someone is Darikinti has raised hand. Yes, anything? Yes, I can see one raised hand. Anything, please? No? Okay. Continuing. Second type of utilization is instrumental or direct utilization. In this, research findings are directly applied or used in day-to-day practice. Like deep breathing exercises are found to increase vital capacity. What some people call it pranayam, some people call it deep breathing exercises. Definitely this has effect on increasing the vital capacity. Hospital policy is introduced as all inpatients. So because of this research study, one hospital has introduced a policy that all inpatients with COPD will be made to do deep breathing exercises twice a day, morning and evening. And that activity is documented by nurses. So you see, direct utilization of some studies can introduce hospital policy or change the hospital policy also. Third type of utilization is the symbolic or persuasive utilization. In this, the research findings are used as tools to influence change. For example, one of my students, still the study is going on. In a study, audio drama and storytelling were used successfully to develop empathy in nursing students. Empathy, we all know what it is. We feel for people whom we are taking care of. Now, usually nursing students, including me, not interested in nursing care at all, because I cannot think the person who is lying in bed is my own person. If I think that maybe my father, my mother, my siblings or my relatives or myself in that position, what I will do as a nurse. If I feel that, definitely my care becomes holistic care. So students' empathetic attitude was used as a variable to correlate with their ability to identify patients' health problems and health needs. And this study has come out very well. Data analysis is going on. So this is one thing, that these type of research findings are used as tools to influence change. So we have seen so far three types of, that is nature of research utilization. If you are discussing, one is that conceptual or indirect utilization, another is instrumental or direct utilization, another is symbolic or persuasive utilization. We'll go to the next. Common types of research. Now, these are the perspectives, from the perspectives of utilization we are talking about. One is basic research, we all know, which generates baseline data. Data are very useful. They are adaptable to another study. Already obtained, these data are generated many times. And they are adaptable to another study in different setting. And useful only for this particular type of study setting. That is the utilization of basic type of research. I mean, the research which generates basic data or baseline data. Interventional type of research, data are very useful. They are adaptable to another area. They have been also obtained many times, adaptable to another study in different area. And they are also useful only for the study setting. And so if I have to apply these findings to another setting has to have similar type of characteristics. Similar characteristics. Like if it is a hospital, both have to be multi-speciality. both have to have departments same, both have to have similar types of patients, then only I can apply this one hospital study findings to another hospital. Now, I'm going to present few research studies in hospital, community, and in education, nursing education area. But we all have to together analyze which study is having continuing effect. Some studies have very continuing effect, which effect of the study findings are so long, almost centuries the study finding effect goes on till the study findings change by another study. Another set of nursing research has transitory effect. That is, the effect is temporary, which effects is momentary. The moment research is over, the effects also go. Another is that very short-term effect. Even during the study itself, immediately effect is generated and effect goes off. So nursing research, if we are categorizing very broadly, in terms of the effects of nursing research findings, how long they exist or influence our nursing practice, we find that broad category is continuing effect, transitory effect, or very short-term effect. Please remember these three because I am going to ask you a question. Coming to few examples. Indian nursing studies in the hospital setting. Developing a protocol on care of patients with third-degree burn. Protocol has been made and that has been given to the hospital to introduce as a policy. What type of study this is? Continuing effect, transitory effect, or very short-term effect? Yes, please. Any one of you? Hello? Yes, I want an answer, please. Otherwise, I cannot proceed. Hello, Nimali? Itumani? Hello? What type of study it is? I cannot hear. Okay. Now, raise hands. Now, what type of study it is? Is it having transitory effect, continuing effect, or short-term effect? You can write also na, in the chat box. It can have long-term, that is the long-term effect, continuing effect, till another type of technology comes and changes the third-degree burns care. Another study is that nursing care dynamics and its effects on ICU patient. Here the ICU patient, that's my own NPCC student did that, this just passed out. She has done nursing process for the ICU patient continuously, and she has collected statement from the patient how they are feeling, and she has proved that nursing care process has definite effect on ICU patients' recovery. So she has actually generated a theory or proposition out of that, and that has continuing effect. Excuse me. Hello, namaskar, sir. हल्द्वानी में सर? नहीं सर, मैं आज नहीं सर, आज सुबह मैं आई, एक दिन का था, लेकिन वाइस चांसलर ने बोला और एक दिन रुको. मैं आज सुबह 6:30 बजे मैं पहुंची हल्द्वानी. हल्द्वानी देहरादून सर यूनिवर्सिटी में वो पीएचडी का मीटिंग था, एक दिन का था. हाँ जी सर, मैं आपको फोन करूंगी सर 1 बजे के बाद सर, ठीक है? ठीक सर, ओके, थैंक यू सर, थैंक यू सो मच. ओके, हेलो, सॉरी. The third one is lived experience of patients with myocardial infarction. What type of, is it having transitory effect or short-term effect or continuing effect. See, this study has only generated data on how the myocardial infarction patients feel. I mean, that cannot be, actually, it may be or may not be same for other patients in other settings. Content analysis of nurses' record. Another study by one of our NPCC student is going on. Their nurses' records are being analyzed to see whether it is properly recorded or not. This type of study, actually it will be continuing, it will be having continuing effect, because from that data, we can find out whether any improvement can be done. Effectiveness of two dressing materials on non-diabetic wound healing. That is another study. One was that dressing material with non-diabetic wound healing. One material was only Vaseline, medicated Vaseline. Another was that with betadine ointment dressing. Both were found out equally effective. Now, it was a hospital-based study. So policy changed as that people can use any material for doing the diabetic wound healing. Now, this is also having continuing effect because it is a policy matter. But till another material comes up in the market and someone else do this study, so this policy will continue. This is having continuing effect, but it can change. Nursing care competency evaluation. These type of studies, we evaluate students' competency, nurses' competency in hospital and community health areas, and this has continuing effect. Nurse-patient communication or interaction. This type of study is also having continuing effect. Another type, some type of studies are in the community health setting. Teaching first aid to school students. This has very long-term effect if we utilize those findings, because those school students, they will be sharing their knowledge and skill with some other children, and it has continuing effect in the community. Safe motherhood program for college girls. Ill effects of alcoholism. These studies are also having long-term effect. Developing a self-help group for ensuring under 5 immunization. Actually, one of our MSc students have done this study. When she found out that under 5 immunization is inadequate, and many children are they are dying because of this. So she has developed this self-help group in that particular community. Now they have taken care of. Now the under 5 utilization within 1 year, it has reached to almost 81%. So this type of study findings, if utilized, it has a long-term effect. Developing a district level TOT program on BLS. This study has been done by one of our PhD students, and the state itself has taken up this particular study to implement it in other districts, because BLS was taught to the panwalas and autowalas and all, and actually it has become a public drive. So this also has a very long-term effect. Perception of aging versus felt age. This is one small qualitative study which I have done, and I have developed the proposition out of this. If I test this proposition or theory, then it may be applicable in another. So this study has transitory effect. Okay. Now, action research on behavioral modification regarding stigma about leprosy, TB, etc. This action research also has very long-term effect if we can really implement it properly. Some other studies on nursing education, comparison of 2 clinical teaching methods on developing undergraduate students' critical thinking ability. This study also has so much continuing and long-term effect because it can be implemented in many educational institutions wherever facilities are there. Learning style and academic performance. Then students' perception of nursing curriculum. Now, these are the studies, actually, they are generating something new knowledge about learning style related to academic performance and also how students look at the nursing curriculum. These are the studies which it can be implemented in such a way that it can change the whole policy itself. So it has long-term effect, continuing effect. Institutional studies like developing a curriculum through the process of evaluation of students' learning. Systematic review of quality of educational instruction and graduates' placement. Historical study compatibility of the trend of nursing education in view of other professional education, and influence of students' government, that is SNA, on developing students' leadership quality. These 4 studies are having long-term effect on bringing any type of change, either in curriculum or in education system or in government policy, and also developing leaders among students. Now, these type of studies are very useful if we are utilizing the findings immediately after the study is over. Now, adventurous or untraded areas of nursing research, which are not many people have done this so far. Individualization of therapeutic position after open heart surgery. One of my MSc students in Manipal, he had done this study on the basis of principles of heart rate variability. That is a typical evidence-based nursing. And he found out that after open heart surgery, as a rule, I cannot change the patient's position to whichever way I want. Not rule. It has to be individualized. Whichever way patient feel comfortable and heart rate variability is stabilized, not too much of fluctuation. And because of his study, one very eminent hospital's policy got changed. And this is something very new type of study. Effectiveness of psychological first aid to disaster victims. Right now, one of our PhD students in our university, he has taken up this study. He is not getting any literature because these type of areas are unexplored. But study findings, once he finds the study, definitely it can be submitted to the government and something will be done about that. Action research and use of homegrown food and its nutritive value. I don't know, now it's only 15 minutes is there. So quickly I'll tell about this study which I myself have done it in Manipal. In one area, you all know what is pui shag. In Bengali, we call it pui shag. I think in Assam is also. And
yes, ma'am, same.
Which is sticky. If you boil it, it becomes sticky. That is actually full of vitamin B complex. So in one area in Manipal, I was actually in charge of the community health nursing that time. I found it grows plenty, but children are having ankylosing stomatitis. Most of the students, children, they cannot smile also. So I encourage these school children without telling them why this is going on. I gave them 1 foot length of this pui, and we used to go along with them to their houses to plant that. And when it became like a jhad, it became like a bush, we were with them, and those children themselves were cooking it. Then they have to eat. We also ate along with them. Then when the ankylosing stomatitis disappeared, then we called all the parents with the help of Panchayat president, and we showed the effect, that benefit of this puisha. No, spinach, I think, or something is called in English. After that, I'm not very sure. After that, whole village, they are growing all the time this puisha. And so the incidences of this ankylosing stomatitis in children has reduced. In action research, both the researcher and the participants, they all participate together in the research process. And so this has very much, it is the continuing effectiveness of the study findings. Another one is that effectiveness of alternative therapies, like nowadays nursing studies are acupressure, then therapeutic touch. Those studies are coming up. Definitely it has transitory or continuing type of effect on changing the nursing practice. Developing a mechanical device to reduce pain during minor invasive procedures. One of my students in Manipal, MSc students, he just put in the BP cuff, he attached this mobile battery, which is vibrating, and he put some music in that. But he decorated nicely with another cloth. BP cuff was tied up. Now, while giving injection or drawing blood, now this, because the mobile battery which was vibrating and generating music, that diverted person's whole attention, so did not feel the pain. So that study was very successful. He devised this mechanical device, and so that in Bombay there is a, actually I sent his name for young scientist competition. There he got award for the award for his idea. And this actually the main, very simple, this is the diversional. He diverted their attention from the focus of the pain by this mechanical device. That is something original nursing research. Emotional intelligence and academic performance. One of our MSc students did it in my college. And through that study, we could understand how we can change our method of teaching learning. So you see, from all these studies, whether it is having continuing long-term effect, or it is having transitory effect, or it is having very short-time effect, but study findings can be utilized, and it has effects either in changing the policy of the institution or organization, or changing the nursing practice, either in educational field or in practice field. Some other studies I would like to mention here: nursing audit and performance appraisal. These are administrative study. Developing integrated curriculum, which is I am working on that, but I have to send it for testing, validating, and all those things. Collaborative research, I have been doing it since 8 years, and I'm trying to generate some valid findings so that I can apply it in some other area. Hospital staff attrition factors. Why hospital staff leave? That is another factor analysis that has also very good result. Nursing care time study. Like we have now, where whichever the hospital is having task assignment, like not the patient total care assignment. You do BP taking, you do vital signs taking, you do bed making. Task giving assignment. There the time studies are being done in some areas, which have proved that this task oriented nursing care is no good. So better to give them total patient care assignments. This because the moment you tie up somebody's mind with time, this person gets bound, thought process will not work. So this study finding also has very good result. It has made the nursing leaders think what type of assignment can be given. Comparison of types of patient assignment, patient care outcome. Public perception of nursing profession, education, service, and research. I wish someone will do this study so that we can change some feature of Indian nursing, because our status is still today not good because people do not know what we know. Developing students' gratitude to enhance academic performance. Now, actually this study, one of the PhD student is doing this study right now. It's a very new type of study, and I am the co-guide for this particular study, and it's an amazing result this study is bringing out. Then I hope that it will bring some changes in our education system. Developing models, theories, and tools. Now these studies are these areas are not much explored. So far what I have seen, the very usual types of nursing care, nursing studies are there. So that findings, how can we make any study finding useful? First of all, we have to choose through our literature search or from our thorough observation or preliminary survey. we have to understand whether my study findings, whether it is utilizable or not. What is the value of study findings? I'm getting my degree doing this research, but what about my study subjects? What I am giving to them? So if I cannot give something through my study, that type of study has no value. So those findings are not having any value for utilization. So selecting a study area itself is a very big exercise to make it utilizable. Other things are that facilities for utilization. That I think Patricia also has mentioned. If we do not have, I may have some big ideas, but if I do not have facility to do the studies or bring out the valid type of findings, then that study will not be useful at all. And then last thing, but not last, I would consider at the first thing to consider, am I capable of doing this particular study? I have to know my own knowledge, my own attitude, my own practice skill. Am I really capable of doing this particular study? And how much passionate I am to do this study? If I do not have idea about my own capacity, my own self, my study findings cannot be utilized properly. It will not have that much value. That is my experience of my own life. Are you with me? Sleeping? Hello?
Yes, ma'am.
No, ma'am. Everyone is awake so much. So many messages were coming in the chat box.
So nobody is sleeping.
Nobody is sleeping.
I'm happy about that. Thank you. Now, why do we do research? One is that curriculum requirement, research for research sake, like these MSc studies. People do research for research sake without thinking whether these findings can be utilized or not. Some PhD people, usually I'm seeing that career advancement. If I do PhD, I get more salary. So I want to do the study. But some other studies are concerned for profession's growth. If I have my focus on either my professional growth or I am contributing something to my profession or to my country or to my organization wherever I am working, if I have that concern, definitely I will choose a study which will have its 100% utilization value. But I should have personal interest. Now, so many students, I see that they are not interested, they are doing study for study's sake. But my students, I always tell them, if you are not interested, you cannot do the study, leave it. You find your own area of interest. But also the guide's interest. Guide and the student both should have similar type of interest. Otherwise, those studies will not have any value. No, students will not get adequate guidance because guide is not interested in the study at all. So it's the guide's duty to help the students to find out, because some students have difficulty in understanding what is his or her interest. That is the value of the guide. That's the responsibility of the guide. Together, guide and the student discuss and discover the investigators or researchers' area of interest. Then only the study will be chosen appropriately for utilization. Then compulsory participation in group study. Some of the, like BSc and GNM research project, compulsorily we make them groups and make them do the study. Usually these studies findings are not useful because this is study for study's sake. Now, just half a minute, I will tell you one very, interesting, still I remember. One of the group of BSc students, BSc nursing students, they came to me asking what should we study? They have to do a project. I said, you find, I don't want to tell you, but I'll give you 1 week time, you find out. Then they came and told me, we want to study whether, see, for diabetic urine, we test, one is with the glucose strip, another is with the Benedict solution. We do 2 types of tests. Now, some very small hospital till today Benedict solution, because the glucose strips some patients cannot afford. They are very, very costly. At the same, I said, it is your project, you find out. But I was watching them. They collected 50 diabetic patients' urine, and they divided into two groups. One, that 25 bottles they did test with the glucose strip, 25 bottles they tested with the Benedict solution. Then they themselves went to the clinical lab to compare. At the end, the result came out that they both are same. They came to me, now what to do? One is not better than the others, both are same. Then I asked, okay, what is the cost? Now, cost, definitely 1 liter of Benedict solution is very less than 1 bottle of this glucose strip. Very, very costly. This book, many people really cannot afford. Now, I said, now you think what you can do with your study. Then they thought and told, yes. Now, people who cannot afford, we can teach them the Benedict solution. But problem is, they may not be able to do it in their home. So, now again thinking, then they wrote their findings that though both are same, but cost effective is Benedict solution. So hospital policy can be that all the diabetic patients, we have to teach both the procedure of urine testing. Now, till today in that hospital, both the methods are taught to all diabetic patients. You see, this is very small study, though it was compulsory participation of BSc nursing students in a group study. These findings, because this particular very simple study, but their finding introduced a hospital policy itself. So that is the utilization value of very small, even this undergraduate BSc nursing student studies. So no research study is insignificant if we have our focus on why to utilize, how to utilize, where to utilize, when to utilize, okay, and what to utilize. You all must be knowing 1 husband and 4 wives. Definitely you have heard somewhere, or some teachers would have told you. What, why, where, when, that is 4 wives, and how, that each is 1 husband. You remember, any research study, if we keep these few formula in our mind, 4 wives and 1 husband, we get our answer, what study I should do so that it is utilizable. Okay. Now, research utilization versus evidence-based practice, already Patricia has very nicely explained. Then I have also little bit I have told about the that is the practice-based evidence. Now this is one very small study which I have done. Till today it cannot be published because I have no literature. I hunted internationally, nationally, there is no literature. Asked hundreds of people, no literature, so nobody is willing to publish my study. Are you with me, all of you? Nimali, Gitumani?
Yes, ma'am, we are with you.
Now, I observed that I was taking care of CRF patients with chronic renal failure. And I found, now how to show you, I told you, can you see me? Now, can you see me here? Okay.
Yes, ma'am. You can see.
Now, this is one, can you see one glass?
Yes, ma'am.
I'm holding one glass. Some hospitals, small hospitals, still today, they put one adhesive. This glass is actually measuring 300 ml of water. So, measuring here 50 ml, 30 ml, 50 ml, 100 ml, 150 ml. So, this glass is graduated. CRF patients with chronic renal failure, their very limited amount of fluid intake is prescribed. Now, nurses are going morning, so many tablets they have to swallow. Only this much, that is 50 ml of here. Water is only this much. Glass is so big. Patients are so depressed. You are giving me only so little water to swallow these much tablets. I observed this type of comments from the patients. Now, this is really frustrating because water is only this much and remaining glass is empty. Now please look at the slide. Can you see? Hello? Hello? Can you see this? 4 glasses?
Yes, ma'am.
No, I went to the market and I bought one ounce glass, that is 30 ml measuring glass. Another is 50 ml. Another is having up to 175 ml. And this one is having up to 200 ml. So I divided because it's a huge dialysis unit. There, one side I had 10 patients whom I did not, I mean, they are usually being given the medicines with this glass tumbler with the adhesive graduated measurement. Another group of 10 patients who, according to the fluid plan, who is getting only 30 ml. I took this very small, that measuring glass, which is 30 ml glass. So water was full now. Patient was telling, "Hello Ratna, I am so happy. Today you are giving me full glass water." I said, yes. You are so happy. 50 ml. So I took this person who is according to the fluid plan is getting 50 ml water. I carried this glass and gave. So like this way, according to the fluid plan, how much water they were allowed, only those measuring glasses I was taking water so that it was looking full or more or less full. Now I made myself 10 points satisfaction scale. That is satisfaction scale, that is 10 open-ended questionnaire to find, this is, I myself gave it a name as visual satisfaction. Now, you see, if food is attractively served, we like to eat, isn't it? Haphazardly, jaise waise, we don't feel like eating. So I found that visual satisfaction has so much importance in how patients will cooperate with our care. Now, one side, those 10 patients whom both sides, before this particular intervention, I have given you, administered this visual satisfaction scale for fluid intake. And I had my data. One side, though it was unethical, later I compromised. One side was getting fluid with those usual, the glass tumbler, that big one. Another side, this measuring tumbler, which was looking full, and patients were so happy. Again, post-test, again after 1 month, I administered the same visual satisfaction scale for fluid intake, both sides. One side where the big tumblers were used, there was not much significant change. Whereas this, where I have utilized those small to bring 30 ml, 50 ml, those measuring glass, those people, high satisfaction level. And they cooperated with all types of nursing care, all types of treatment. And they are telling hereafter, please give us. And so I distributed according to their needs, so many, these plastic measuring glasses I gave to them. Now, it was a real evidence that, and these type of studies are never done because till today there is no literature. That was my own thinking. Now, these type of studies I would like to call is a practice-based evidence, because this was my observation of the patient satisfaction. I tried to do something and I have generated an evidence that if the water is looking almost full, patients are highly satisfied in their fluid intake. Okay, so this was a very interesting study. Are you with me? Okay, hello?
Yes, ma'am.
Okay. Now, factors facilitating utilization of research findings. One is personal factors that all of you know, attitude, interest, and inquisitiveness. Others are institutional support, institutional facilities. Then professional, how much emphasis nursing profession is having on clinical research or any type of research. That depends on the institution to institution, it varies. Then situational, are we having adequate time, adequate manpower, adequate facilities? These are also, I think, had been discussed by Patricia very well. Factors facilitating utilization of research findings. Now, where do you start? So, first of all, we have to understand what is the purpose of research. Then we have to do need assessment by preliminary survey, observation, whichever way you want. Then we have to do thorough literature search. Then only I have a strong foundation on what basis I can develop my research process. Then during research process itself, as research process is going on, I can change certain things. After completion, periodic follow-up or reinforcement of the interventions, publication, extending to other settings or different focus with different focus. Like that only we can promote the utilization of findings of the nursing research studies. I know you are still with me. So we'll go to the next slide. But most important, which my own personal feeling, that feeling of moral obligation to our study subjects. Then only if we choose our research studies areas, it will be utilizable 100%. I have to have feeling for on which are the people I am utilizing for my study as my subjects. I have the moral obligation to do something for them. And that is the core of the utilization of research findings. Thank you. With best wishes for optimum utilization of study findings. Thank you so much.
Thank you, ma'am. It was an indeed informative session. I believe all the participants must have adequate knowledge. And thank you so much for the time and effort you have took to share your thoughts and experience. Now the session is open for discussion. Ma'am, we have one question from one participant. We want to know what are the different ways to increase the research findings, to increase the utilization of the research findings.
Last slide I showed, that's the last slide. You please look at it. First of all, we have to do preliminary survey in whichever area I am interested. Then I have to do lots of literature search. And then very importantly, I have to think on whom I am going to study, what is their need. It is the need-based study. If I choose a study which is needed for some organization or some people, then only there is a scope for utilization. Okay, that brings my feelings for my people. Okay.
And there is one more question. If we are not having adequate ROL, does it affect the quality of our research?
Definitely. But another way, I mean, this undergraduate level, it may not be possible. We can generate our own basis of the study. If I do not have ROL, I can do one preliminary survey. On that basis, I have my own study. Like one small example, my PhD study, I had no data about the lifestyle. Now, lifestyle is culture-basic, culture-oriented lifestyle. I had no information, no literature. I searched everywhere. So what I did, 50 families I went. I only asked only one question. What do you understand by health? Now, all of them told so many things about health. 50 families, I did interview each one 3 or 4 days. Now, from all those data, I did content analysis. Then, till the data saturation was arrived, I found 12 points which are commonly told by all the 50 families. With those 12 points, I developed my own lifestyle tool. So, if literature information is not available, we can generate our own information, and that we can utilize for our own study. That's another way. Okay, is it all right? Yeah, have you got the answer?
Yes, ma'am.
Okay.
Thank you, ma'am. Now I request Ma'am Professor Nirmali Gogoi to speak few words. Ma'am, we cannot hear you.
Yeah, that's it. Nimali is not audible.
Ma'am, Nirmali, we cannot hear you.
Oh, Nimali, you have to unmute yourself. Okay. Still something is wrong.
একটু আনমিউটে হৈ আছে ন মিউট হেৰি হোৱা নাই তো ঠিকে আছে তো
You can share the PPT, no issue. You can share the PPT because it has no literature.
now
And
you start Nirmali নবনীতা খুদাছে না আছে না
I'm coming to Gitu's place, madam. I'm coming to Gitu's place.
Yes, ma'am.
Hello. Ah.
Nice to see you, Nimali, after
Yeah, really, I'm so happy, madam. My view most of the time on yours, this one, yours only compared to the slide. Madam, your presentation is excellent. Really, it is a wonderful presentation. It is that all these things are, it is a usable. I think all the delegates, all the respected delegates will benefited and inspired from your presentation. I hope. And we are also learn lots because all the each and everything in regarding the utilization of the research in your life experience, it is really tremendous impact on our field of our nursing. I hope everybody is benefited from your presentation, and also really in personally I'm very much benefited from your presentation, ma'am, really. And I'm so happy, and in future also I want to meet you more. In first time I meet you in this one Nainital in 2016 in Uida Gitu, and from that only it is really we never forget you, your caring and loving in spite of your busy schedule in the Nainital. It is you organize a grand this one event. In spite of you were coming to meet to give the goodbye to our hotel. It is really unforgettable for us. Really, thank you so much, madam.
Thank you. It was a pleasure. Okay.
Yeah.
Thank you so much, ma'am, once again. Now I want to hand over the next session to the next moderator, Ms. Lakshmi Gogoi.
So a very good afternoon to one and all present here. I, Ms. Lakshmi Gogoi, Assistant Professor, Assam Downtown University, Faculty of Nursing. So at first, here we come to the last speaker, but not in the list. We are very grateful that we have another renowned speaker, Ma'am Dr. Elsa Sanatungi Devi. Ma'am, I welcome you on behalf of Faculty of Nursing, Assam Downtown University. Madam Dr. Elsa Sanatungi Devi is a Framer Fellow or Foundation for Advancement of Internal Medical Education and Research. Madam is a professor and QMR at Manipal College of Nursing, Manipal Academy of Higher Education. Ma'am also is a coordinator in first IELTS Center in India in collaboration with NIH and UK. Madam is a fellow observer under USIEF grant for 21st century. Madam Dr. Elsa also takes keen interest in advanced geriatric workshop for nurses at Salam Hospital, Kuwait, and also participate in training Indian academic nurses towards capacity building towards elderly care under the DHR grant. Madam keenly mentors the community health officers of Manipur in strengthening and building capacity towards their competencies in developing elderly health promotional activities. She has numerous research articles published in Scopus, and ma'am have presented a lot of research in international and national platform. Ma'am is also the president gold medalist for best outgoing student MSc Nursing and TNAI. Apart from this, ma'am is the reviewer for Journal of Environment and Public Health, Journal of Clinical Epidemiology and Global Health, Worldwide Conference Singapore, International Journal of Nursing and Midwifery. Is the life member of various professional bodies such as Alzheimer's and Associate Disorder Society of India. So she is the life member of various another professional bodies like TNAI, Nursing Research Society of India, Press Freedom Promotion Network of India, Karnataka Society for Pharmacoeconomics and Outcome. So we have such a great and renowned person with us as a and is going to talk about the enhancing visibility of research paper. So this section is over to you, ma'am.
Thank you, Ms. Gogoi. Can I expect that organizers to kindly mute all the participants because there's a lot of background noise out there?
It has been already muted.
Okay, thank you very much. At the outset, I would like to congratulate Dr. Gitu Moni for organizing this international e-conference. And thanks to pandemic, I think we are able to see each other much more than what we were facing before. So with her new appointment as a research director, and with her wanting for visibility in research, I think it's very apt that she has chosen a suitable topic which another speaker was supposed to deliberate. And I'm very happy to speak on a little bit about enhancing visibility of our research paper. I'm a vice person in research, yet I would like to share a few things which audience can take through and you can utilize them in your own research and how you can go about making yourself more visible with your research article. So thanks to all the organizers and thank you Downtown Guwahati for inviting me in a very short period of time, but I didn't want to fail Gitu Moni. So, yeah.
Thank you so much.
My outline, I will finish before time, although time has 20 minutes has gone. I'll try to make it up. So my outline for the presentation will be, how publication evolution has evolved, and 7 common reasons why we have poor visibility, especially in nursing, and 9 reasons for why our articles are being rejected, because rejected means visibility. Can you mute those people, those who are on, on the background noise? Little distracting. Yeah, thank you. So how to publish and then get yourself noticed, or your article being noticed, and how to publish and then get it clearly noticed, and publication in today's world, what is happening, and sharing and promoting your research article, sharing options for different contexts of what you want to be highlighted, so that your visibility increases, and also some strategies to improve your article visibility in today's world of scientific sessions, and measuring journals impact, which is very important when we look out for where you want to publish, and some success story which can motivate all of us. So if you look at this picture, when you want to publish one article, it takes quite a bit of your time and energy, and after finishing writing the article, we look back. When it gets rejected, we look back and see what's wrong with it, right? So before seeing what is going to be wrong with it, I think we need to go ahead and then look at it, how clearly, how methodologically we have gone about, and how meticulously you have done your research, so that there is no bias and the true picture and true facts and figures appear, which can have impact on the society. That's very important for us. So if looking at the evolution of publication and its impact, if you look at, we all academicians especially are looking forward towards publication. Now, if you don't have publication, it's like publish or perish. There was a time when you say publish or perish. Now it is like publish in high impact journals or high impact factor, or say publish your articles in Q1, Q2, Q3, and Q4, okay? Quarter 1, 2, 3, and 4. And we're looking at top 10 journals in the world, and we're looking at, otherwise you perish. Now again, is the next phase that we are in is publish frequently in those top journals. So today, sorry for the little distraction. Okay, so today, if we will actually perish if we do not publish it frequently. Now, for example, like where I'm working in Manipal, unless you have Q1, Q2, your appraisals are flattened, right? There is nothing called you will get the highest grade of pay. So your payment, your pay scale is totally dependent on your publications, your research, and your publication, and your visibility. So this is soon coming to everyone. Okay, the top 10 top universities are already going ahead with it. UGC has already paid a guideline so that we should have publication this many with impact factor, H index, and so many things are being required today. So before that, I think it's high time that we realize in nursing where to go about. Now, when you say H index reflections, most of us in this audience would be lecturers, assistant professor, associate professors, and well-known professors working in various. So can you just tell me your index factor of most of you? Someone who is moderating the session, please look at the chat box. Assistant professors, how many of you have how much H index? How much H index you have on your Scopus ID? You can see the chat box. Someone who is moderating my session, please look at it. Assistant professors, any assistant professor in this group, just you can, even if you have nil, you can write nil. Even if you have 1, you can write 1 or 2 or 3 or whatever you have, H index. Here, H index is an author level matrix that measures both your productivity and also how many people have cited your publication which you have published in the past. Anything has come into the chat box? And the associate professors, those associate professors in this audience, you can also write yours. You can write associate AP, and then you can write if you have any H index, or just put only the number also is fine. It's okay for me. Associate professors and also professors. Now I'm targeting the professors. How many of you have how much H index? Is Monica out there? Can you see the chat box?
Yes, ma'am. I'm checking the chat box.
Anything has come? If it is not there, also you tell me. Actually, I need to continue.
Ma'am, all are eagerly to listen your session only. So like, thank you.
Okay, fine. So
Yes.
that means all of us are looking at what is my, I think this is, H index would be our surname now as a academic professionals. We need to look at what is the H index. H index is going to tell us an author's level metrics that can measure our productivity in your research and also the citation of the publication that you have. So if you look at the world analysis of looking at how much an assistant professor by now should have is, you should have H index of 2 to 5. Okay, 2 to 5. And for associate professor, H index should be somewhere between 6 to 10. And a professor, full-fledged professor should be having almost 12 to 24 H index. So please go back and see what is H index and go back to your Google Scholar and go back to your Scopus index using your ORCID ID and see what is your H index, which is very important. This shows complete. You don't have to explain, I have this many publications, but when I log into your Scopus ID, I should be able to find all these right in front of my face. Okay, so all of us need to look at this. This is going to help us in many ways. When the administrator looks at your appointment, administrator look at your promotion, they look at your visibility. This is what visibility is going to be about. Okay. So why to publish? Ideally, if you look at, because right time publishing your result is very important if you have done a research. Because if you delay 2 years, your data will be outdated. So no journals will accept. Some journals, where there are no index journals, they may accept. But if you're looking at top journals in the world globally, if you look at Q1, Q2 journal, they won't accept your articles because the data can be already outdated. So in the life cycle of research, you need to actually publish your results authentically right in time, which is very important. Okay? To exchange our ideas with the global scientific community, of course, because research has to be applicable globally. And so they look at how we look at the data, how they look at the data, because we are ethnically very different, race-wise we are very different, things could be very different, culturally we are different. Okay? To share that idea itself is another way why we should publish. To create evidences, which Dr. Ratna ma'am was speaking about, to have evidence, we need to publish. Unless I publish, who can find your literature? You're talking about review of literature. So if I don't publish, people will not get the literature. So if you've done a good research, it is mandatory that you need to publish right in time. So for your own recognition and also discoverability, okay, further what you can see and improve more, and also reusability, which is important for our own societal impact on a community, what can be reusable, re-research and further research, and then find more solutions to the problem that we are facing. So looking at now at all of us sitting here are professionals, maybe doing MSc or say being a lecturer, assistant professor, associate professor, director, whatever position that we hold. Now, when we do publication for the youngsters, is they're looking for a job. Now, without publication, nobody is taking you straight away. They screen you off on the entry level, and also on the other side to keep to your job. Unless I get my publications, how do I stay in my job? I may be degraded also. That is always possible in an institution where eminence is expected. You can be even downgraded from or demoted also. So one is to get promotion. Some of us do publication to get research, to get our PhD cleared, and without 2 publication you can't clear. Now 2 publication in Q1, Q2 is the criteria. Criteria is getting harder day by day. So I think all of us need to start and then get into the mood of research, because research is not something you will do and stop and be there. But you need to generate interest, and then you need to be very inquisitive about it. One thing is that institution now, Gitumoni is holding a very important post of research director. Now getting funding, getting big grants and funding, and unless funding is there, you cannot continue with your research. How long can you run with your money? It's not possible. So you need to get grants. So to get funding means you need to have already generated a good publication, a good work done already. So practically what we are looking at in nursing, if you look at the nursing and health sciences, is to improve practice or to improve our clinical output. See, all of us work for, in academia, we work for our students. Students are primary customer, but in the clinical, if you look at patient is our primary customer. So to improve the patient care, we need to, or improve the practice, we are doing all these researches so that it has some importance on our practice. So we need to do a very robust manuscript, which already eminent speakers have already spoken about. I'm not repeating on that. And there are 7 common reasons why we have poor visibility. Poor visibility, number 1 is financial crunch in academia. Now, how many of us can afford to, have all these top journals being visible for your organization? How many of us? I'm in fact privileged that Manipal has almost everything under the sky. You get it online, and library is almost inside my home. I can access anything from my home. I can look at the best of the journals, top journals, and facilities are given. Incentive is given where you can use it for your publication, where you can use it for your presentations. All that is given. But how many of us do get that? So there is a financial crunch on academia because we cannot carry on without grants, I said. And on the second part is that poor study design in the published papers. In nursing, most of us go pre-test, post-test design. We go very primitive design. But today, if you want to publish in top 1 journal, this is not going to be taken up. Be very sure. Your research methodology is important. So what type of methodology for the same is important for any public? They'll simply reject. Looking at the design only, they simply send you back at the same speed that you sent. Next is lack of replication studies. That's why you're not finding review literature, which is consistently giving you some sort of linkages to your research. Problems with the peer review. Now we face a lot of problem as an author also when we send to the publishers, to the editor, and then the editor gives it to the reviewers to review whether your article can be accepted. It's a very difficult task because these reviewers are not paid money or something like that for their reviewing, but at the same time, the accountability for their professional, as a reviewer, they also need to pay much more time to review an article and say it is rejected or it is accepted or what suggestion to be given. Remember, they are not paid. So there's also a problem with the peer review. If you don't get it properly, if it gets published, and tomorrow if it is a kind of a fake data, then what the reviewer as well as the author can get into issues. Okay, the problem of research accessibility, all of us do not get access. Like as I was telling you, I have every journal or every publication that comes on the top 1, I can see it right away. But how many of us in different parts of the country, especially if you look at Northeast, how many of us get access to all this? Because some of us still depend on the journal print copies, but now it is almost getting open access. So how many of us have got access to the open access to get the articles downloaded? So it will be very difficult for every one of us in nook and corner of India to access this. So there are some solutions to where universities can collaborate, and then students actually can access and researchers can access. So there are strategies for this. Lack of adequate, accurate science communication. So there is a gap between the scientific community and the public. So that's another strategy I'll be talking to you in the coming slides to see what strategies you can implement so that your scientific language is translated into the community's ability to understand a kind of language which they understand. So this gap has to be reduced. And also stressful nature of the academic life. Now all of us are struggling, publication, grant, this, that, and then so many things for the institute. First of all, we were all struggling with how to get your students. But now we are looking at how to get your article published, what research to do, where to apply for grants. All the time we are online searching for every nook and corner. So these are some of the 7 reasons why our poor visibility is. So we need to see that these systems, what we have mentioned, are improved so that academicians can have a very fruitful, enjoyable journey of research. 9 reasons why they reject your article. 1 is not within the scope of the journal. So when you want to write an article, sometimes in nursing what we do is we start writing the article as per our requirement of the institute, but you never look at what is the journal requiring. So first look at where you want to publish. What type of your research is your article type is published in which kind of journal, with the methodology, what type of journals will take up. You need to screen on yourself and see with your article. Then you write according to that journal's requirement or the format that they're giving you. So because what happened, you start writing and again transform into another format, it is double work. So what you do is you need to look at the journal where you want to publish, and then write according to their format, and then cite studies from the top journal, and that's how your article gets into place. Poor grammar and spelling. We are not to forget that all of us studied science in English and everything. The medium of instruction, most of us have studied this in English, but still we have problem with grammar and spelling. And this language editing has to be done thoroughly before you could send for any of the articles for publication. Lack of structure in the writing, inappropriate analysis means for the objective, what analysis and why, why that particular reason for the appropriateness to be explained. Plagiarism, someone has very rightly spoken about plagiarism. We don't tolerate any of the plagiarized material. It's straight away in the institution itself, it gets screened off. Again, they screen, even if the student says, I have only 2%, again, we screen. So plagiarism is not accepted for any sort of scientific publications. Author's instructions which are not followed for that particular journal. Methodology inappropriate or not detailed enough means your methodology, that is the most important thing in your research, is not being explained properly or not visible or not tangible. And sometimes some people just brush up. That's not fair in research. Methodology has to be very, very robust. Ethics requirement not fulfilled. Though any study now, when you do, even if it is at the MSc level, we do the institutional research committee clearance, then and we have the ethical clearance of the organization. Then you have to do a clinical trial registry of India. And if you have a foreign partner, you also need to go for HMSC registration, which takes little more time. So you can expect that ethical clearance will almost take 6 months in time. So the researcher has to go a little more advanced in time. Can't wait for the last moment, because research is not something part-time. So we need to think ahead of time and see, because if you have collaborators from other countries, you need to also undergo certain clearance from the country's HMSC. So these are things we need to keep in mind if you have collaborators from outside. Reference taking lacking or heavy self-citation. I have seen one article where the author has cited his own publication 10 and 110 times. This is not actually favorable. They all know that you're oversighting yourself. Okay, so better you cite from those journals, top 10 journals. If you cite, I think that visibility increases, and their citation will increase, of course, and your relevance will increase. So these are the 9 reasons why sometimes your article can be rejected. So how to get your research published and then get noticed yourself, okay, which is very important. We are going to talk on that. So publication in today's world, if you look at, there are 2.5 million scientific articles are published each year, and that number is increasing because it has become a mandate. Yeah, so how can you make your articles stand out is what we are going to talk about today. Okay, so how each one of you, your first article that comes online also should be a very happy moment. The first time, you see, if you look at the Nursing Journal of India, today the Nursing Journal of India, RTNI journal, is not indexed. The quality has improved, everything has become very beautiful, but it is no more indexed in Scopus. But in those days, when I published my first article in 2007, my first article, this was a group of students we did, and then we published, and that was indexed, Scopus index. So till today, that is my first publication, and I always appreciate myself and feel that even those days I have ventured into publication, and which we are looking out today. So the zeal need to be carried on. But those times the paper was not so good, but it was indexed. So Scopus indexing is important for us to know, okay, all of us. So with whom you will share and what global impact you will make is important with your research. So when you want to do research, youngsters, those who have already done your PhD and gone into your field, you know you're going to your own field. But youngsters, you need to think what is that you want to do in life. It's not that one research you do, jump into another. Once you have done your PhD, you need to get focused into your area of research, and you need to go deeper and deeper and deeper. Vertically, we need to go. We are all going horizontally, but we need to go deeper into your research. What is the impact? You should be known for something that you have done. If it is a piece of work process, you should be able to be known for that. So what is your contribution at the end of life is important for us to look at what global impact you're going to make. So sharing and promoting your article, sharing and promoting forms an important part of your research, because you need to exchange your scientific knowledge. Whatever is your finding, you need to contribute to the scientific knowledge. Okay? That is for future progress, bringing your research and accomplishment to the attention of broader audience, and that will make your visibility much higher. So that means you need to emphasize. Okay? No one is going to proclaim for you, but you need to initiate yourself. It is not self-proclamation all the time, but you are proclaiming with a research finding, and that's authentic. It's not just a perception that you are taking, but a research finding. Okay? So sharing helps you get more citations, enabling you to cultivate a stronger reputation for yourself, promote your research, and move forward in your career. So all of you are very young. I see, except for few of us here who have grown older and older in nursing, so many of you are very young. You have lots to grow, and you have lots to look at in life. So, and the research, if you see in the Northeast, is very, a very primitive stage, I should say. And you have lots to, you can do a lot of things in research. And only the thing is that you need to widen your scope. Okay? So benefits from sharing, the appropriate version. You may ask me sometime, when abstract come, can I just send the abstract? For me, I should say that you need to send a full version, because when you send a full version, you always get a credit of getting your citations. So if you want to get good citations, correct citations, you always have to have the appropriate version or the final version being shared. Okay, so that they will cite it and you will get appropriate citation. So till as of now, if you do not have Mendeley account, please do register, which is very important, because Mendeley here is also used for your referencing. So you need to register and get yourself. Okay, there are so many things that we ought to do as a researcher. So the integrity of the scientific record is not compromised. So upload the most up-to-date version of your article for the readers. So you need to share a link. You can always share a link with your colleagues, with your fraternity, with other fraternity in different fields, because your area could be, for example, let's say cardiovascular. So cardiovascular doesn't have only nursing, you have also cardiovascular in medicine, the cardiovascular thoracic people, cardiomedicine people, you have also maybe allied sciences who are dealing with the CVCD and things like that. So you can always share with multiple platforms and multiple professions, so that you get cited by people who have already had good high index, H index. If their site is, your visibility is always more. So best option to share, as I said, as I just mentioned, is that the final published article, if you can share, that is the best thing. So you can go on to online, how can I share it.com, you can go, you can link it. I'll be sharing with you this slide, so you can always use, or you can snapshot and you can go online, right? Type there, how can I share it.com, and you will get all things how to share about your articles. Okay. So now almost all of you are techno savvy. So I think I can have the privilege of telling you some of the things that you can explore yourself, because self-exploration is the best form of learning, instead of someone dictating on you. So just have an idea and then get more into, and then get deeper into your learning. Okay. So sharing options from different contexts. You may want to share your article at the conference. So after your public presentation, they even sometimes they charge you some amount for their putting into their journal or putting into their book, and so many things. Okay, so you want to publish it in your conference, or for classroom teaching purposes, you want to share, which your student can use the research finding into the classroom for grant application, because you can even tag people. There are people whom I know from the grant funding agencies. So if you tag your research findings to them, or they know that, okay, this girl is doing research in this area, so you get noticed. I'm not saying that they'll give you grant for whatever you share, but they'll get noticed. Okay, so with your own colleagues or reprint server, or your personal blog, your website, all of you need to have your personal site and blog and so many things, other than jumping around only with your Instagram and only with your WhatsApp and Facebook. I think you also need to have your own personal blog where people look at your scientific progress. So on your institutional repository, so like in Manipal we have MU repository. So any grant that I apply, I has to be entered. Every article that I publish has to be registered. So without that, because they give us incentive. The very nice thing about this institute is, for every publication, if you are publishing in a very good impact factor and top journals in global context, you get very good incentives. Plus, you get even if your article is so good, you get very big incentives you get. Okay, so these are the reasons why we have the motivation to enter. Whatever comes to your account on your publication, it goes to the repository. One thing is for the institution is to look at what their people are doing, or their faculty are doing. Okay, that visibility is there. Already you are visible, and your visibility will enhance again. So many people will be watching at what is Manipal doing like. Okay, and so your visibility is enhanced one side. One side you're also getting incentivized, so that you're motivated to go beyond. Okay. So in the institutional repository, you should have, if you have not had, I think Gitumoni, this is the appropriate time to have your institutional repository to see all levels of faculty getting into their publications. On a subject repository, on a particular subject, if you are doing research in a cardiovascular and thoracic, you can also put into their repository in that particular organization, okay, or the particular association, which gets visible to many of the thoracic or the cardiac medicine and things like that. So on scholarly collaboration network, you can also do, or such as Mendeley and Scholar Universe, you can also share the context And social media such as Facebook, LinkedIn, Twitter, everywhere is possible now. This has become the lifestyle of today for all of us. So you can share so that when you tag someone, that person's contact list will get, all of them will get visible onto your whatever you have tagged. So it will keep increasing. So if it is of their interest and someone is needing it, it will go far and wide. Okay. So these are the ways how you can share your articles so that your visibility can be enhanced. So sharing link. Now, few tips that you need to look at. Sharing link. When you publish with Elsevier, in most cases, you will receive one share link. Okay, so this share link remains for 50 days. Imagine 50 days on your article on your Science Direct remains for 50 days. So whoever, if you have shared your link and whoever, touch on your share link, they'll get direct access to your article. That means you will get the article downloaded. Otherwise, it's very hard to get a full article. Because during these 50 days, this is the high time that this is the time you need to canvas more and share more so that people get to download and read your articles. So the more people read, the more citations can come in. That is how your visibility increases. Okay, so you can pass your share link on to your colleagues, friends, and family, and use it to promote your article by email or social media, whatever you want to use. Okay, so anyone who clicks on that will get to download from their share link within the 50 days. So within the 50 days, if you are able to promote yourself on your article, you can enhance your H index. You can enhance your citation, means increasing your H index. So you can go to this link and find more about how to share link. Okay. So 2 tips to increase your publication visibility. Number 1, you need to update your profile. All of us have some profile. We need to upload their profile. I'll just show you some profile of the scientists. Okay. Is it visible to you? Is it visible?
Yes, yes, it is visible.
Yeah. So this is yeah. Hello. Yeah. You can just see. His name is Thangzam Guneshwar. Okay, he's a guy from Manipur. He happens to be my nephew. So not because he's my nephew. He seems to catch. Yeah. Can you unmute yourself, please? Yeah. Thank you. So just look at this person. He is now just around 35 years old. So by the time he is 32, he already has 2 postdocs. Okay. So he finished his MSc in geology. He did it in Jhansi in India. And later on, he went down to get his research fellowship in lunar geology. And he worked for the Chandrayaan-1 Space Application Center. In 2012, he got his PhD. And within 2016, he has got his 2 postdocs. And he was working in Max Planck Institute, one of the scholar institute in Germany, Berlin in Germany. And he works for NASA. At that time, he was just 32 years when I met him first time. He's awardee. And if you look at why you need to improve your profile is the scientific interest he has in surface. He works for space. Okay, so obviously his area of interest will be space. So we need to also specify what is the area of nursing. Also, you can specify. So awards and recognition. Now he is named after asteroid Thangzam. Means 11806 is his ID, which is given by the International Astronomical Union in 2017. He is named after one of the asteroid because he has done his research and he found a particular asteroid. So this is how he was given. So he worked for NASA and he was in the team of NASA Dawn mission to Vesta and Ceres. Okay, so these are some of his credentials as a young person when he is just 32 years old. So you can see his major publication, and why you need to update your profile of publication is if you just again log into this and look at his citations. So he's only now he's working for NICER he is in the planet science in Bhubaneswar. He's there for a few years in India. He's come back to India. His H index is already 16. He's only an assistant professor. So we were thinking that professors should have somewhere between 12 to 20. So if you look at his H index, it has gone very high. And if you look at his publications, it's only an assistant professor who is just 32 years old. So you can see his number of one publication is more than sufficient because his mentors are all from ISRO, his mentors are from NASA. And if you look at his profile and his collaborators, you can see their high profile. So this is how you need to You need to get back onto your feet to see that your visibility increases. Okay, so am I back to the slide? Can you see the slide?
Ma'am, the profile is optional actually.
Yes, it is.
So can you see my slide now?
Yeah.
Yeah, thank you. So in the second point, in how to make yourself more visible, write a layer summary. Now, why layer summary is, if you write a systematic review, you also write a layer summary there, because sometimes the public who are not from the science background cannot understand what is your finding there. Your jargon in medical terminologies will not be understood. So we need to write a layer summary for the people why that particular publication was important for the public. Okay. So when you have layer summary, you can also log into this and find out how the layers that can actually improve your publicity. Today, nursing fraternity is going ahead, talking on radio, talking on TV, on health, and many other things. Okay, there are some this kind of publicity also will improve your visibility. Yes, nevertheless, when you write your layer summary, you need to write the purpose and the method of the study that you have done. Why is the study being done in that? For example, you take COVID today. Okay, who are those people whom you studied? What is being asked on the subjects? Okay, how many subjects have you taken? What interventions were done for them? If applicable, will the subjects be randomized to different groups, whether it is control group or experiment, whether you will get Covaxin or whether you get Covishield? Okay, so how long will the study last? So you need to have a small layer summary and tell why it is important to the community. So if public knows about what is important to them, they'll be able to understand, okay, this publication means we have to do this. Okay, so when you write a layer summary, and if you share in your link, that also gets across to the community who are not from the scientific background. So next thing is present at the conference. So all of us do that. And so presenting and networking personalizes your work, giving face-to-face, voice-to-voice, sitting over a cup of coffee can bring a lot of collaboration and networking. Okay, make sure you connect with other delegates on Facebook and LinkedIn. So today you should be having a barcode where you don't have to carry your visiting card. Once upon a time, you used to carry visiting card. That's not required. You have your barcode, people scan, they know who you are. So you can write all your blogs, that also into your account. Okay. So if you create a poster for a conference, post it to your website also, so that you'll remain on your blog, your social media profiles, online CV, and also institutional page, so that it gets visualized everywhere. And this is how your visibility increases. So we are also familiar with the use of social media. Okay, so you can use, there be billions and billions of people on Facebook, Instagram, and TikTok, Twitter, WeChat, Weibo, so many things. And still you can log in. I have given you the site with what you can do with it. So social media is also a place for online networking. So now the world, you don't have to look at the distance of how many kilometers you fly to the US. You can have everything, as if you're sitting next to the person, you can still discuss and have research fun and, talk about research and talk about many things. Okay, so there is an art and a science to using social media. So we should know also. For that, if anybody wants to do, you can also do a Coursera, or you can do a kind of a module, so that you know exactly how to use authentically and also how to use legally, because we cannot just misuse social media also. Okay, so you can get fired back. So you can also do a module for youngsters, so that you know how to use it. And the fifth point is share your story with the media. So sharing with people also is important. When I was writing this point, I remembered way back in 2000 when I was writing an article on presentation of women in media. And so I have a lot of friends from Media Times of India, and I have people from Open page and things like that. So I was writing against the media, because today, if you look at any advertisement, you have a woman who is may not be so presentable to us if you look at, unless you are in the film industry. Okay, so I was writing all against the media, how media actually portrays women so badly into the media. So I was writing. So if you write against the media, you'll not get covered. But I was going on talking to the media person, so they know that Elsa is writing about presentation of women, but that at least get noticed. It will not get published. My article will not get published, but at least they know that I am for this and what is my idea behind it. Okay? So these are things you get, to share with your media person. We do not sit only in the context of nursing. We also need to broaden our space and friendship and the location. You should know every walks of life so that you understand. I'm not saying we should become somebody else, but we need to know and understand more about others. Okay. So tracking your impact, which is very important point here. So whatever you do, it is going to be visualized in your this thing, in your lookout. So please look at your collaboration, which is very important. How big is your network? You map and see how big is your network. Who are your people in your network? Where are they located? In which part of the world? Okay, and on your scholarly output, how productive are you is going to be visualized from your H index and your publication list that you are sharing. Okay, article metrics is who's talking about your paper online and what's being said by others. So you need to look at this like how you take media surveys. Okay, you need to see whether people found it interesting. Okay, for me, I work on dementia. So whenever there is something to do with dementia, I always share my link and people look at, because only people who are growing older understand what is the meaning of caring for elderly. Okay, so this is how paying importance to one's research is, and also your journal metrics. Okay, and the journal status. What is the status of the today? What is Q1 may become Q2. What is in Q3 may become Q4. What is in Q4 may come down to Q and no quarter, and maybe sometime even become back to work. So you need to know the status of your journal status to where it is. So when you're going to send the article, you should know where it is standing, whether it's in Q1, Q2, Q3, or Q4. Then you need to apply. Okay. Otherwise, by the time your article comes, one Q may fall down. Okay. So let's not do that. So we need to look at status of the journal, good journals, top journals when you want to publish. So in later career, your citation counts. Okay. So how many articles are being cited by somebody? Okay. How many have received and cited? Outstanding articles. How many articles? So if you have published 10 articles, which one of your article was one of the best articles for which you won an award? Okay, for which you got best article award, or which you have got we have got very good impact factor and things like that. And looking at your H index. So this matrix rates your entire publication career based on both your output and your citation impact. So if your H index is 11 by chance, it indicates that 11 of your research articles have each received at least 11 citations. Okay, so one need to understand this. So you need to track your H index carefully, and you have to keep a track, and not only tracking, but you have to strategize yourself to see what next and what beyond. Okay. So your Scopus profile, which we have seen already in the previous profile of your Scopus, I have shown you. You can get credit for your work and explore for your metrics, online higher metrics. When you have done with the research, you want to make sure you're credited with the publication, so your metrics reflects your work. So your author profile in the Scopus, use your ORCID ID. Okay, please create your ORCID ID, register and know, so that the moment you have the online already they are calculating for you. You don't have to go and calculate there manually. It will already calculate for you. So find out your H index, discover who is citing your publication, and also validate your Scopus profile. So you can go to this link and then you can edit your profile from time to time and see that you progress. So this is your self-monitoring device, which you need to do for yourself for your visibility. So next is article level metrics. There are also two things which you can use. Social media sharing, PlumX metrics is one which you can use. I have given you the link here, so you can see your Plum metrics directly on your panel on your article in Science Diary if you want to see. So how social citations can also improve your in the indexes which you are looking for. Okay. So news flow is another, which you look at the societal impact of uncovering relevant mentions of your research across tens of thousands of mass media outlets across the world. So it gives you a way to measure the wider impact of your work by tracking and analyzing its media coverage. So Newsflow provides nearly real-time feed on news articles. So you can use this elsevier.com/solution/newsflow. So these are the links you can use, and you see how you can share and get updated on your coverage or your leveraging yourself. So measuring a journal's impact, you need to know usage, okay, how many citations are coming, peer reviews, citations, all metrics, okay, all these things need to be looked at when you look at a journal's impact factor. And also you can always go to online and search which journal is in which status. That is already available on Google. So success story. My first PhD student, he worked on diabetes. For self-management of diabetes, and he published his article in the Clinical Nursing Journal, and this was the International Journal of Nursing Practice, which is a Q2 journal, and his article was awarded in 2017-18 as the most top 20 downloaded articles in this journal. Means it's a very big prestige for a student who is doing PhD, and also being a person who is doing on self-management on diabetes and how you are leveraging people to be self-sufficient in their care. So this article got captured, and this was so his certificate was given by Willie to him as top downloaded articles of the year 2017. So these are some of the success stories you need to imbibe yourself so that you get some motivations to carry on. So my student is doing very well, and he has been so much in demand by the physicians. Whenever in the OPD patient come with diabetes, they say go to Alred. So he is given a clinic all together. He ran the clinic the whole time, and entire patients with diabetes were with him. So these are the type of coverage and the leverage you give for your community people. That's the impact which he has on the people. A grip of language, grip of scientific knowledge, and the grip of what to do. Tips for learning how to maintain one's diabetes status, and also how to live healthy. So these are things which has impact on the society, right? So thank you so much. I think I finished well within the time. We are just one, and let's stay connected. Thank you, Gitumoni, for the invitation on short notice. Thank you so much.
Thank you very much, ma'am, for your wide knowledge. And ma'am, I really hope, and I am sure enough that each and every participant is very much happy with the presentation you did, and you were sharing your knowledge. Ma'am highlighted the regarding publication, which is very, very important each and every one of us right now, and also about the scientific record and sharing about the article and how we can utilize the social media effectively through our research article. Thank you very much, ma'am. So,
any questions for me?
Yes, ma'am. There is a question. Ma'am, it is about question is asking, like, when we try to search for sponsorship for any articles or for conducting a research study, we have to go a very long process. So there is any easy tactics or any easy way to get sponsorship or like to conduct the research study?
Okay, the question is very simple. We have to work very hard. When you write up, see, don't look for sponsorship. Okay, you should be looking for a grant. So India has so many grants depending on what type of research. So if the candidate is wanting to do, for example, say something to do with the say elderly, for example. Okay, so you have for especially for Northeast, there is a special grants which already government of India is already giving it. So you need to know what is important. So you need to write a very good proposal, okay, with all facts and figures of what happened in your state and why are you looking at the research. Okay, with the deep down, if you have some publications on that, is very good. Otherwise, also you can write a very good, with a very good methodology, you can apply for grants. So don't look just for a sponsorship from somewhere, but look for grants. Compete with anybody else who comes onto the platform. Apply. Now grants are open. This is the time grants are open. ICMR has already opened up. DST is opening up. ICSSR. So depending on what research you are doing, okay, if you are doing on social science, you need to see ICSSR. So there are so many funding agencies in India itself, and Northeast has a special funding for research. So you must target and apply that. There are so many areas. Every field, every specialization has scope for public for a grant. So please sit down together, have a good collaborative team. Don't sit alone and write, because you need to have experienced people also into the team and have a very good team, so that the possibility of getting the grant is higher when you have a collaborative team. Okay, that is, I mean to say, the interprofessional approach. Not because I am from a fellow, but working in team with different disciplines is always appreciated by the funding agencies. So you can always get. There is no age bar. Even if you are very young, if your research is going to be very good and very useful to your state, of course they'll give you. You must apply and defend for it. Okay, so but you need to write a very good proposal, which is very important.
Very much, ma'am. I hope we got their answer. So at last,
now you have Gitumoni sitting there as a director of research. So you have to give a lot of pressure on her. And I'm sure she has a lot of collaborators. So make use of your collaborators. Okay? So you can take foreign grants also. You can ask for foreign grants. Okay, you need to go to the entire process of foreign grants. You can apply to. There's no harm.
Professor Elsa, Shanda, Tumbi, Devi, I hear your lecture, quite interesting. But what I found after giving so much information about the standard of publications, impact factor, good journal, but still many of the academic, even very good academic institution, faculties are publishing research papers in third-class journal. I used to say third-class journal. And if a journal comes out from UK or France, people think that it is great. But that journal is so poor, so bad, but still Indians used to publish. First point. Second point, India is having so many journals which does not stand anywhere. And they publish it just getting the money. Why such things are happening? Do you have any answer for that?
Thank you very much, sir. Sir, namaste to you, and the very senior person joining us and highlighting on that's what we are looking at good journals. So when actually as authors, we need to search for good journals and apply to only good journals for publication. In India, what happened is there are some journals which are Scopus indexed. There are in especially in medical field there are. But all of our articles may not be applicable to that journal, may not be appropriate to publish in that journal. So most appropriate platform is important for the researcher. So I as a researcher has to look at which article is best for my article to come out. So searching takes little time, but hunting for the quality, whether it is Q1 journal or Q2 is important for us. So as an individual, I think we have to avoid the predatory journals. There are so many predatory journals nowadays. They attract you online and so many things. Let's say submit, we will publish in 15 days and so many things. But we should not be fascinated by those. Go search for quality and then confirm, then only send our article. So that way we can make some changes. And here, when the administrator imposes them to publish, people go for predatory journals sometimes just for the publication sake. So that we should stop, because research is not every day that you can produce a paper. So if a very good research is being done, it should go to a very good journal. It should go to a very good journal.
Thank you.
Thank you, Madam Elsa, for accepting my proposal at the need of the hour. As we have as a resource person, Dr. Professor Roti Balachandran, Madam, ADG, Government of India Nursing. Madam could not be with us due to her ill health. So instead, so I have to look for another person. So Madam Bivi Kathiani and Madam Professor Elsa Chenatombi, who is kind enough to accept my proposal in the nick of the hour. Thank you so much. And you have elaborated the topic so beautifully, and the tough topic, you have made it so simple. As we have lots of participants in this platform, we have around 167 participants. In another platform, we have same amount of participants. So that those participants, most of them are students, so that they can review. So we have given another link for them. So I think it will be very much helpful for them. And by the time we was knowing what is research or what is good publication, what is age index, my age was half gone. So by the time I have already more than 10 publications which were not useful now, telling now. So like that, I felt that this is the need for the Northeast people, or even in India, many of the people maybe like me, whoever having this, maybe they are not in the knowledge, even when we have sit for searching for the topic, what we should take up. And in the faculty itself, everyone felt that need of that enhancing dissemination of the research findings. So we have taken this topic. Thank you so much, Madam Elsa, for accepting my proposal at the nick of the hour. I'm so sorry also disturbing you. Although you were sick, you have accepted our proposal. Thank you so much once again.
Thank you. I can't leave you just like that. I know you, and I'm a Northeast person, so I always value that from my Northeast. It's always, my interest is always there.
Thank you.
I'm happy to share with anyone.
Thank you so much.
Thanks. Thanks.
Very nice to know your knowledge. You are so much knowledgeable. Thank you.
Thank you. Thank you. Thank you.
Please
So,
move ahead.
enlightening us with your knowledge, and with wholeheartedly, I'm thanking you once again, ma'am. And in future also, we would like to invite you, ma'am.
Thank you, Monica. Are you Monica, right?
I am Lakshmi over. I'm using the system. That's why
I got confused. Sorry. Thank you. Thank you.
Thank you so much, ma'am.
Thank you for your beautiful words.
Everyone. So here, next session, I would like to hand over to Madam Cooper for the valedictory session. Thank you. So the end of the story is the new begin for many others. A very warm afternoon to one and all joining with us today. I, Ms. Rikupar Yawim, Assistant Professor, Faculty of Nursing, Assam Downtown University.
And I am Ms. Anusuya Goswami, Lecturer, Faculty of Nursing, Assam Downtown University.
And we will be the moderator for this session. So on behalf of Faculty of Nursing, Assam Downtown University, we are honored and extremely happy to welcome all our dignitaries, eminent speakers, delegates with great joy and immense exaltation to the valedictory session. So at the very onset, I would like to thank each and everyone for joining with us with patience for 3 days, especially our esteemed speakers and judges, and for their who took their time out of their busy schedule and showered us with their wisdom and knowledge and making the conference a successful one. So once again, thank you all.
Our first international conference started from 25th March 2021, and it was scheduled for 3 days, that is till 27th March 2021. And it started with a short inauguration program, which was followed by the various topics shared by our eminent speakers. The conference was based on the theme Disseminate Scientific Session, Ensure Quality Practice, and 7 eminent speakers from around the globe discussed on the theme in detail. We are indeed very happy to have them here with us in this conference, and we are very happy to say that 390 delegates from various parts of the world have joined us for these 3 days.
So our faculty have a brilliant and talent to show. So now I welcome Hiramani Perman for her songs.
यांनी फॅन बंद केले.
What language is it?
मावशी आज थांबणार आहे का तुम्ही? मला थांबायचं होतं पण मग आता
শোনা যায় না, গান করছে।
Not visible.
Thank you so much, Hiramani, for your melodious voice.
Now, I take this opportunity to invite our various resource persons to share their key words on this 3-day conference. I request our resource person to kindly share their valuable words on this conference.
How it has come. Hello? May I speak? Few words?
No.
They're asking.
Yes, ma'am, your face is little dark. We can hear you.
Yes. Nagendra sir is also here.
Yes, ma'am. Very nice to see. Thank you. Thank you.
Very happy to see Gitumani and Nimali, and very much thankful to the university, vice chancellor, and other authorities for this invitation to this great occasion and the event. And thank you, Dr. Gitumani, Dr. Nimali, for organizing this very, very important meet. Though it is this virtual forum, but the speakers, I have learned so many things from other speakers. I have attended most of it. As usual, Dr. Elsa Sanathambi, though she has really put so much thought in that, and we all are encouraged by that. Thank you so much once again for giving me this opportunity to part of this great learning event and the gathering. Best wishes to all of you. Thank you.
Thank you, ma'am.
Yeah, Sridevi, I'm Sridevi here. And can I speak?
Yes, ma'am.
Yes, ma'am.
Yes, we can.
Yeah.
Oh, nice.
So I'm not in the video because I'm really not dressed for that. I would like to say something that I'm so extremely proud that I am on a platform with Madam people like Rati Balachandran and Ratna Prakash ma'am. I can see Nagendra sir, and today only I could attend Elsa's talk, but I think this whole conference has been a nice circle, because what Elsa told you, if all of you have been following, was exactly where I started. If you remember, I said writing is only the beginning and the rest is all about journals, citations, H-index, I-index. She didn't tell you about I-index. And somebody like me, and we also mentioned that the younger generation has to go on because we started a bit late. And I was surprised nobody wrote about H-index, because yes, I'm somebody who didn't do much, but I still have an H-index of 6, which is not bad, but this was a very, very late start. I started in 2014 or something like this. So the youngsters have no choice. Remember my SciVal, which I showed you. The SciVal is the Elsevier site, which reflects learning. And Elsa recently published along with Ramesh on the music therapy in cardiac, and it got published in International Journal of Nursing Practice. And I really congratulate them for this great work, because they are into doing systematic review. And this is the Z or Z of the alphabet A to Z in publications. And Manipal is really doing well ahead. However, I have this message that it's hope. Now there is a hope that we will probably be on the international arena. So I request or thank, other than thanking the Vice Chancellor for giving me this opportunity, I would plead to every university, and let's start with Assam Downtown University, to provide everybody, medical and nursing people, with extremely good databases, so that like Manipal, they can all say on my phone, I can search my article. This is exactly how we are here. I can on my phone find any international journal, any article, and do a lot of work even when we are having few minutes. So invest in good databases, Cochrane, and also provide such mentorship programs so that constantly people are connected with each other and they can go ahead and do publication. And please, for heaven's sake, today somebody had written, one of them shared in the FB, one of my students, that India has the highest number of fake journals and publications. So please, I beg of everybody who's trying to publish that do not look for Indian journals and get your UGC approval and finish it. Please look for international visibility, even if it's a Q4 journal, Q4 journal of Scopus Index, which is less than like 0.5 impact factor, 0.8 impact factor. Start there, and please do not go ahead and publish anywhere without any visibility. I mean, PhDs currently are doing this. They're publishing in any journal of neurology in India, any cardiovascular journal. People are making money and you are getting trapped. And once your journal article is published, you are fixed, because you cannot then send it to another international journal. So please, if you have difficulty finding proper journals, contact Ratna Prakash ma'am, contact Elsa Sana. I will give you my contact. You can look in Google for Scopus Index journals. There are lot of help available. It is our attitude that defines us. And attitude in nursing is extremely important. We need to get more international visibility. We need to do service for our country, and research is the most backward in nursing in India, and we are nowhere on the international map. So with these few words, I'm sorry for giving this advice, but yes, I'm also almost retiring. So I think I can take this few minutes to tell all this to young people. Help is available. Just go ahead. Best wishes to everyone who will start to write and publish. Take care.
We can't see you, Dr. Sridevi. Can't see you.
I'm not in a state to be seen.
Yeah. Not in a state to be seen.
Thank you so much, ma'am. Once again, we are very privileged to have you here with us. Again, thank you so much for sharing your valuable words. I invite other resource person also to kindly share some of the few words.
We'd like to hear from Madam Patricia Vanderloop from USA.
I am here, but it's also very late. And
it's okay, ma'am. I can understand you might be sleeping and we are making you awake.
I do. I have my alarm set. So no, I'm awake and I'm really glad to be here. And I too wanted to thank you. And I enjoyed the discussion, the presentations that I listened to very much. And I know that we have so very much in common, and we're just all trying to do the best for our professions. And I'm glad I could hopefully contribute anything, because I know I learned from you guys as well. On the way home, I was wishing that I had included the evidence-based journal criteria, because somebody had asked about that, and I was hoping that that I would have put that there. But anyway, and then is Dr. Ratna here?
Yes, yes.
Oh, okay. Did you work at the Himalaya Institute in Rishikesh? Okay, yes. Well, I was there with you. With Dr.
You have come there.
I did. Yes, I was there several times. Yes. So we have met.
I was there for 5 years.
Okay. It was about 10 years ago, but I was there maybe 3 or 4 times, I believe, when you were there.
Yes, yes, yes.
Our world is small.
Yes, I was feeling how your face is so
Is what?
Hello.
Hello.
Hello. I was feeling that your face is so familiar.
Yes. Yes.
Light
yes.
officer.
Yeah. So very nice to connect again.
Yes. Yes. Hopefully again we'll meet in life.
I would love that. So yeah. So thank you very much again.
Thank you so much, ma'am.
I would also like to add, ma'am, please allow me to add some points.
Sure.
Yes,
sure.
Yes, thank you, ma'am. Professor Geetumani ma'am, to give me the opportunity to really be part of the conference. And it's my experience that this conference was a wonderful learning experience and a platform for us, for all the participants. It was really wonderful experience where we could learn, we could even get motivated to publish articles in good journals. Like just now, Professor Sridevi has mentioned that how to be visible in the international arena, and where the Indian nurses don't find much place right now. So it is really needed, and this conference is really an eye opener for all of us, that what are the the points, the quality work, how it is to be done, and how we should make ourselves visible to the international people, and our work should be published in the international journals. So I guess it is really a motivational, it has been a very motivational conference for me at least. Thank you so much, ma'am, for this conference.
Thank you so much. We would like to also hear from Arwin Fele, sir. Sir is with us. Sir, please few words.
Yeah, I hope my internet connection is good, no? But I would like to congratulate the organizers and also to the participants who are here. I know and I do believe amidst COVID-19 pandemic, the commitment is there to really move forward and share your contribution to the society. And now I would like to share the quotation by Albert Bjorky. He actually mentioned that research is to see what everybody else has seen and to think what nobody else has thought about. And this is actually a major challenges for all of us to see what is actually different from others. As a nursing professionals here who are very committed for the nursing care, going beyond of it, borderless, I'm sure that research is one of our weapon then, our commitment and our passion then to really serve our people, the society that we are caring of. And it's like Nightingale, the founder of nursing, that really she actually adopted also research when she actually doing a certain care, nursing care to everyone. And this is actually the call for all of us, the basic principle and the basic principle of nursing to nursing professionals, to all of us. I become a researcher is all about impact. It's not all about impact them to the society. About impact is always nourish, beauty then, and factor.
Their bandwidth is
It is actually only an impact factor is just an, but then, of course, this is actually, we must actually focus on the impact society. How much impact to the society then it's used, its future there. All of them that I'm of
Hello. Okay.
Thank you so much, sir.
I think my internet is very, very slow. But I hope that we become actually, we actually have this then in terms of research. And I would like to challenge all of you to really do research in a way that you are not actually pushed and actually compelled of, but then we are all passionate and commitment and dedicated to do research in all aspects in our daily routine. It becomes blood and of course our water. We are thirsty in terms of knowledge, and we are committed with the flow of research. All of us done for this exercises.
Thank you so much, sir.
Thank you, sir. I would also like to hear from Ma'am Vijay Kathayani, ma'am. Ma'am has been here with us Ma'am, please share your few words.
Oh, very happy afternoon to all of you. I know I'm a special guest. So I was really listening to all of them. It was, and I my pranam to my mentor and my guide, Dr. Ratna Prakash and Dr. Nagendra Prakash. So I am really happy to see them. Hope you are hearing.
Yes, yes.
Yes, ma'am. We would like to see you also.
Some disturbance is there, so that is the reason. Okay, okay. So I'm happy. So I had to be associated with our conference, and I'm thankful to Dr. Geetumani for giving me this opportunity. Though it is a some kind of blessings in disguise. So I also should I have learned many things in this conference, and especially Elsa has done a wonderful presentation, and also listening to Shri Madam also. So I am really happy, and I wish the university all the success in future endeavors. Thank you.
Thank you, ma'am. We'd like to hear from Dr. Nagendra Prakash. Sir is with us.
Thank you. Now, I was very curious to watching some of the deliberations, and this is a very most thought-provoking, probably a leading conference in India. So I congratulate Dr. Geetumani for this, and Nirmalia for this, and this is really most important. But I request the next conference should be how to make the nursing faculty use the nursing data in teaching the students in clinical area. So I earnestly feel that then our students will start liking the nursing profession once the teachers take data, clinical data, every data and research available to apply, in the clinical area. And therefore, every college should have a special meeting on which are the data they should make use of it, and which teacher is going to do this. This type of action-oriented program is very important, so that Indian nursing will pick up very fast. And I congratulate again all of you, and it's an excellent program. Thank you for permitting me to speak.
Thank you so much, sir. Please proceed.
Yes, ma'am.
So I also take this opportunity to welcome Dr. P.K. Day, Faculty of Pharmaceutical Science, for his short speech. Sir, over to you.
No, just a hello.
So BK, okay, then I would like to proceed. I'm also very privileged and honored to welcome Dr. Balagopalan Uni, Advisor Research AdtU, to kindly share his valuable words on this conference. I have seen that Sir has been with us towards the whole, throughout the whole program. He has been giving us advices, and he has been putting on questions and comments in the chat box. He has been very active throughout the session. Sir, we would like to hear some words from you, sir.
Thank you and good afternoon to everyone.
Good afternoon, sir.
Very hearty good afternoon to all the speakers, Chancellor. I've seen Vice Chancellor somewhere, Dean of Studies, Chairman, Dean of Faculties, along with the Fraternity of Nursing, faculties of various disciplines, and all parties. Please mute when somebody speaks. I could see a highly unique and talented speakers from national and international level. Institutions delivered lectures from 25th to 27th March till today. Most of the topics very much relevant to the theme of the International E-Conference, techniques for effective dissemination of scientific findings and quality practices, organized by the Faculty of Nursing, Assam Downtown University. I'm sure and confident that all the participants got excellent opportunities to listen and interact with the learned lectures. In fact, I have seen the speakers from UK, USA, Oman, India, and most of the other parts from India and abroad, and many of them have touched many very important topic on the research. In fact, as on today, this topic is very much relevant to our university. Our university has come up now with very good research atmosphere. University is also having a good standing, and most of the speakers have touched upon regarding the research and also the visibility of the research. Whatever the research you do with the grant in aid projects, once it goes out your outcome, it should be published in a very good journal. I fully agree and support with the Elsa from the Manipal University said, it's very true. There are large number of publications, journals which comes out from India, even abroad. We just publish it, but that journal does not have any standing. That means the visibility has gone. So you must see that your papers, your research outcome must be published in a good impact journal. This is what I was talking since I became a part of the university from March 2015. Physically, I was there till March 2019. I always speak about that. Whenever even the nursing fraternity used to publish papers, but try to see the standard of the journals. And again, every faculty must know the H index, the I index, and then try to have a good papers published. Whenever you have a NAC committee visit, whenever you have a UGC, they always go for that. Research means good publications. The talks given by most of the speakers covered basic to applied research and how the research outcome to make it more effective through publication, and also talked about the utilization of research for the benefit of the society. They also touched upon some of the crucial points, such as how to formulate the best research ideas in the form of a society-based projects, art of good research paper writings. The most important point mentioned and discussed very seriously in their speech is on plagiarism. That is very important. Their lectures covered academic and as well as the research trends. All the lectures were highly informative and useful to the faculties and the students, as well as very much fit in the theme of the conference. On behalf of the university, I convey my greatest appreciation and very sincere thanks to all the speakers from various research institutions and universities from India and abroad. Most of the talks delivering highly informative lectures in the conclave organized by the Fraternity of the Nursing of Assam Downtown University. I also convey my thanks to the entire team of the Faculty of Nursing for their, and the Dean, Nursing and others for their continuous, untiring efforts for the successful completion of this lecture series in the conference, and hope the same type of conference will continue in future too. I'm extremely thankful to the management of the university for their excellent support as usual for all the time. Thank you very much for giving me an opportunity to be the part of the conference. Thank you very much.
Thank you so much, sir.
Dancing is surely the most basic and relevant of all forms of expression. Let us now enjoy a dance performance by our very own and very talented students, Ms. Meenakshi and Ms. Upasana.
So next, I would like to call upon Professor Dr. Dharmeshwar Das, Chairperson Research Faculty, Assam Downtown University, to give his short speech. Sir, are you there with us?
Yeah, I am here. Am I audible?
Yes, sir.
Okay. First of all, I would like to thank the entire faculty of nursing for inviting me to speak a few words here. I would like to congratulate the entire faculty, all the members of the faculty. As a matter of fact, all the entire university, whosoever is involved in organizing this first ever international conference on nursing practices. So it's a commendable job that the faculty has done, led by the dean and the directors of your faculty, and the teamwork that I have seen in the entire faculty in making this international conference a very successful one. So I think the nursing practice is really an important practice, important profession that one cannot avoid in anybody's life. And the healthcare journey that takes place in the life of the nursery practitioners is very important, because unless and until you give your everything for the welfare of the patient, nothing could happen. Everything is translated. Whatever technology we generate or disseminate, everything is in practice, in place, wherever it is needed, only because of the nursing profession. But this nursing profession needs to be improved, needs to be done a lot of work because with the dissemination of the scientific knowledge that comes from the research work done in various fields. So scientific data, the output of the research is very important to disseminate in their service or in their practice. There are two things I consider very important is the modernization of this practice by using the scientific knowledge and practice. This is very important, and that has to be computerized, and that needs computerization everywhere, and that needs to be translated into practice by the nursing profession. Besides that, there is also a lot of things that we need to do is on the quality assurance. Even if we have very good technology, very good theories, very good protocols, but still then we have to be we have to see the quality of these practices, and the quality assurance also needs research, and how to improve upon the things, it is always there. It's a dynamic process. It's a dynamic profession. It cannot stop in one place. It has to go with. Right from the neonatal stage to the adult, right from the patient coming in to the recovery, there's a lot of steps, a lot of scientific endeavors are taking place. So always use the dynamic practice protocols. That is what is needed. And I have seen in this conference, a lot of presentations were made on papers, findings. This should be database, this should be digitized, this should be practiced, and our students should learn how this modernization has done. Once we go for that, then definitely it is, we are sure that the profession will be always progressing. Progression is the thing. We have to grow along with the advent of science, along with the technology. And unless and until we grow, nothing can happen. I wish all the success to the faculty in the future also for arranging this type of conferences, and also have the brainstorming session on these aspects so that we can go ahead and serve the entire human society. With these few words, I extend my thanks again to all of you for giving me this opportunity. And I also I get this opportunity only because of our Honorable Vice Chancellor, Administrator, who is administering the university, and the management, who has been always kind enough with us to go for the university's upliftment with the different professions, different faculties, and so on. Thank you so much.
Thank you so much, sir. It was indeed informative and motivating for us. So thank you so much, sir. So BK Day, sir, has joined us. So, sir, I would like to welcome you for a short speech. Over to you all, sir.
Yeah, am I audible?
Yes, sir. Yes.
Thank you so much. First of all, I'd like to mention that the effort which has been made by the Faculty of Nursing in organizing this international conference with a very, very pertinent topic, which is onto the theme of disseminate scientific findings, ensure quality practice. I'm sure that all the proceedings, all the resource person has elaborately discussed about what are the techniques for effective dissemination of the scientific finding and quality practice, and also have addressed that what are the need and the importance of proper documentation of the scientific findings that we normally get after a scientific or after an experimental procedure get over. So I think that this is something incredible we at this present moment. Young faculty members who are about to start or just taken up the research problems to either pursue their PhD or to prepare some project for funding. I think this particular conference would be very much beneficial to all of them, because they will have a rational background of their proposed hypothesis, because this is how the hypothesis is well accepted when it is rationally thought of, rationally fabricated. And the importance and the objectives are to be very, very much clear before making up or fabricating this entire designing of the hypothesis. Now, I'm really happy to see the panel wherein eminent speakers, they have experienced by all the audience, and the speakers from different corners of India and abroad, they have shared their experiences and their knowledge, what they have come across. And this is how we actually got connected with different part of the world. And this is one of the example of the dissemination of knowledge and information. And at this present moment, when because of this pandemic COVID situation, again it is threatening us, and as we have adopted the new normal in the last year, or probably during this period only, as the online process of, or online using online platforms as the media of our communication, transaction of the knowledge, information, that thing we are continuing with. And the best part and the benefits of this online platforms we have extracted in terms of connecting people with staying in different parts of the country as well as world, and getting their views, getting their knowledge, and then implementing those knowledge and information into our day-to-day basis experiments and day-to-day basis research activities. So once again, I really want to thank our the organizers of the Faculty of Nursing, young faculty members who got involved in organizing this entire international conference, and of course with the able leadership of the Director Research and the HOD of the Nursing, Faculty of Nursing. I think this is a very good step, and I'm sure that this is the first of its own kind, and this will go further. And that way, the faculty members in totality, including the students of the Faculty of Nursing and the researcher who are involved in research activities, they get benefits out of this conference and proceedings. So with this, and with a big applause to the facilities and the environment, the kind of environment that has been extended by the administration and the management of the Assam Downtown University. This is the one of the best place where a faculty member can actually pursue and think of attempting his or her research ideas to implement, to resolve the local and regional issues. And that is how he can also grow his career, her career, and in totality the university also will grow. So this is a win-win situation. Through this kind of activities, we actually grow ourselves as well as the university also grows. So with this, I thank once again to the entire organizing committee. Thank you so much. Thank you.
Thank you so much, sir.
I'm delighted and privileged to welcome our Honorable Vice Chancellor, Sir, Professor Dr. N.C. Talukdar, to kindly share his valuable words. Over to you, sir.
Thank you very much. Where I see the valedictory functions, the speakers were given very little time, but spirit I see in appreciating what has happened last 3 days. I guess it was extremely successful events, and I wish I could attend them. When I see your valedictory functions, you have mixed with cultural items. That's fantastic. Congratulations to the organizing team, and my heartfelt gratitude again to all the distinguished speakers who have spoken, and I'm sure all the participants will now go with different techniques for effective dissemination of the scientific research. They do the result that come out of scientific research, and also look into the quality aspect. I found there is an interesting, like very serious suggestion. I think Dr. Nagendra Prakash, what he said that what we have learned from this conference, the outlook is very, very positive. A lot of new techniques, tools have been, the knowledge of different techniques have been given to the participants, how to translate them, how to use them. And he brought out the issue of using scientific research data in undergraduate and postgraduate teaching. That's extremely important. Like the knowledge you give to the students from textbook that you read, in addition to that, the research helps create knowledge. I've said in some other occasion that whatever is listed in the textbook are result of experimental findings or research findings of maybe last 50, 60 years, which is a proven knowledge it comes. And the students, postgraduate students take part on that, like research scholars, PhD research scholars take part in knowledge creation, but it's extremely important that we prepare undergraduate students, master degree students to create knowledge when they go for higher education, like higher learning, PhD. The preparation should be right from the undergraduate level. That should be taught to them, that this research finding, research results, knowledge that people generate spending hours of their life in the laboratory, those students should also know about that. That's extremely important. I hope, I think your valedictory function has been quite long. I don't want to take a lot of time. I hope a lot of techniques have gone into the heads of participants. I just wanted to share about 25 years ago when I had on physical mode, had the opportunity of taking attending a workshop, how to prepare for an effective presentation. And the second session was how to write an article effectively. So the first thing I learned was that one important technique or tool in making an effective presentation of the scientific research is that speaker must, when you are physically present in front of a group of people, you must stand very confident, very erect. And that moment you come to the stage, the very posture with which you stand, the posture you take, that itself gives a lot of, to the audience, that you are a confident man, you're going to learn, that audience, they feel they're going to learn a lot. So this is one technique I want to tell you, that these effective writing or effective speaking, I said in the beginning also, in the inaugural function, it's a skill that requires a lot of practice, a lot of perseverance. It doesn't come just like that, because each one of us, we know, even the organizers, scientists or teachers of the nursing faculty, you know, if you have your own students, I have my own students, the PhD students, and when you ask them to write a paper or start writing work or writing part of their thesis, they will be procrastinating, they will be delaying. So because I have dealt with maybe 30, 35 students, it is the case every time, and I tried to analyze why that happens. It happens is because it is easy to speak, and it is easy to speak in a group, but it is not easy to speak in front of a group of people because you get recorded. The same way, it is even easy to speak in front of a group of people, but it is not easy to write what you speak, because if you write that, you are kept on permanent record that will stay forever. So people are afraid. Though he may be a potentially very good poet, very good scientist, do a lot of research in the laboratory, but he's afraid to write, because I think that goes with human ego, that we all the time want to be best, and always have a doubt. The sir has asked me to write, so I may not write the best, he may not like it. So that we have all gone through. So question is, we cannot become based in a single day, but that confidence, that preparation to become based should always be there. So based writing, based speaking, or generating knowledge, scientific knowledge, research-based data, and then publishing it, its dissemination, it involves a lot of perseverance and dedicated effort. And a conference like this, or the outcome or deliberations in a conference like this, provide confidence to the participants that they will take this as a very serious thing, and they have been made to know that it needs a lot of effort, and which I think all the participants will continue, and each one of them will be confident and do a good job in writing their research or making presentation of their research data in the conferences for the benefit of the scientific peer or in respective field of studies. I won't take much time. I once more extend my hearty congratulations. I find it was an extremely successful event, because that, as I said in the beginning, the participants or the speakers of the valedictory functions, the way they spoke, I saw a lot of spirit. I may not have seen them in the tone. I noticed a lot of spirits. That itself reflects that it was a very successful event, and that's why I congratulate the strong team of organizer. And once more, very hearty gratefulness to all the distinguished speaker, eminent scientists who has taken part, and the best wishes to all the participants that whatever they have imbibed last 3 days get reflected next time whenever they take up this scientific research, writing, or communication in front of a group of people or in front of society. Thank you very much.
Thank you so much, sir, for your valuable and motivating words. Now I would like to request Professor Nirmali Gogoi ma'am, Conference Secretary, to announce the best presenter for the scientific paper presentation. Over to you, Nirmali ma'am.
Am I audible? Okay. Very good afternoon to all of you, Honorable Vice Chancellor sir, and all respected dignitaries, distinguished guests, and eminent resource person. For I'm as a conference secretary on behalf of all the committee of the conference, on behalf of Faculty of Nursing, on behalf of Assam Downtown University, my heartfelt thanks goes to all of you, each and everyone, for your valuable times given us, sharing and valuable experience sharing with us. I'm very much thankful to all of you. And I'm glad to announce a very exciting, I think everyone is exciting, the result of event, very important event of the conference. We have the paper presentation, scientific paper presentation, along with the plenary sessions. It was 25 and 26, we had the paper presentation session. We are getting lots of papers from all over the countries, different part of the countries, but we feel regret we are unable to anticipate all the papers in this platform. From this, we are on scanning, we are selecting the 12th paper from this all. Then from the 12th paper on the 25th, it was a 5 papers presentation, and in second day it is 26, it was a total 7 papers. And for paper evaluation, we have the national level evaluators, 3 evaluators of each paper, and on basis of evaluation of the evaluator, we are selecting one paper only as a best paper among the 12 papers. And this paper is based on, it is the topic, it was evaluating the impact of simulation-based video on postoperative education in a view to assess the postoperative outcome of patients with cardiac surgery. This paper is presented by Ms. Sai Priya Nashiar. She is MSc student from Department of Medical Surgical Nursing. She is from CSIJA College of Nursing, Tamil Nadu. She is a very young researcher. We have so many experienced researchers also, but we are selecting the young researcher because she is very enthusiastically she is doing this research, and this topic is very time relevant because of this situation in COVID time. It is simulation based video, it is simulation best practice, simulation based video is very time relevant. Thank you so much. Her paper is selected as a best paper as evaluation on evaluation. And I congratulate to Ms. Priya Nashiar, and I request all the delegates and all the participants to give a big hands to her. Thank you so much.
Thank you, ma'am. And congratulations to Ms. Saipriya for winning the best presenter.
Now we would like to hear any feedback from the delegates or any suggestion for our better improvement in future.
Good afternoon. Hello.
Yes, ma'am, we can hear you.
Am I audible? Yeah.
Yes.
So good afternoon to all the delegates and dignitaries especially. So on the behalf of all the delegates, myself, Sonali Banerjee, I take the honor and privilege to sermon the response of all the delegates for the first international e-conference conducted on the theme of disseminating scientific findings to ensure quality practice, which was organized by the Faculty of Nursing, Assam Downtown University, for 3 days under the mentorship of vibrant and dynamic Professor Dr. Geetumoni, and with the organizing secretary, Professor Nirmali. The entire team was very efficient in showcasing their hard work, coordination, and commitment towards the successful completion of the conference. Moving on to the topic, it was selected very aptly, looking into the need of the hour and providing us with an enriching experience. I would proceeding with further thing, like I would like to quote something, like good leaders develop ideas, great leaders, they develop people. The best leaders, they develop new leaders. My observation over 3 days was that the best researchers, they tend to develop best and new researchers. So the eminent speakers across the globe, Professor Sridevi, Professor Dr. Erwin, Ms. Patricia, and across India, Dr. Lata Venkatesh, Dr. B.V. Katyayani from NIMHANS, our senior mentor, Dr. Ratna Prakash, Dr. Elsa today had given excellent deliberation, and the observation further was like the slides they would have presented, but the content which came up was not from the slides, it was from their enriched experience which was really speaking, and they really wanted to make an impact onto the delegates so that they take it forward to provide a good quality research work. So across the globe, Indian nurses are excellent in the clinicals. Now it is, I guess, the right time for us to take up the baton of the nursing research, like so that we get totally engrossed into research. And the benchmarking is already set. So it gets even tougher for us as new researchers to take it forward from there. The only option is we do a good quality research and do not hesitate to disseminate it, whether it is a conference platform or it is in a writing form in a good journal. And we have talked a lot about it for the last 3 days. So finally, I would like to thank the entire organizing team. So they have provided us such a lovely platform. The scientific sessions were excellent, with excellent inputs from the experienced judges, from their experiences. What we little lacked was the personal interaction. Had it been in person form, we would have interacted more to have those good and excellent delegates from abroad and India. But nevertheless, it was overwhelming and a very excellent journey for last 3 days. And like we take it forward from here. And thank you so very much. And I'm thankful to Gitumani ma'am to have provided me this opportunity to speak on behalf of the delegates. So heartfelt thanks and namaste from here. Thank you. Over to you, Miss Monica.
Thank you so much, ma'am.
Thank you so much, ma'am. Now I would like to request Professor Dr. Gitumani Kaur, Conference Chairperson, CAM Director, Research and Outreach, Faculty of Nursing, Assam Downtown University, to kindly deliver her vote of thanks. Over to you, ma'am.
Thank you for giving me this opportunity to speak. And these 3 days was wonderful for us. And along with the delegates, I also learned a lot. Hopefully our delegates also, they have learned a lot. And we had total 390 participants from 19 states of India. So we have participants from Jammu to Kerala. Then we have participants from Sikkim to our Maharashtra. So we have covered total 19 states. This conference we have decided to organize on February 18th. I have joined in this institute on 4th February, and by 18 February, we have set for a meeting to select the topic for organizing this conference. We could release our brochure on 1st March, and we should have, what I felt from my heart, we should have given 1 more month to organize this conference. Then there would have been more people would have been benefited from this. So we have got time only near about 1 month. So it was not even 1 month, it was 20 days to circulate or disseminate the information that we are organizing a conference. The time was less for the dissemination of scientific papers. So hope next time if we are organizing second international e-conference, we'll organize it 6 months ahead and it will be a grand success. I could find out few low falls during this conference. So hopefully we will be overcoming all that low falls on the later one. So on coming to the vote of thanks, I would like to offer my heartfelt thanks to the Assam Downtown University Management Committee. I would like to offer my sincere thanks to Dr. Anand Datta, Honorable Chancellor, Assam Downtown University, whose constant support and effort make it possible to organize this conference. He could not be with us during the inaugural session, but Sir has sent his message today that please don't feel bad, I could not be with you all, through his secretary. It's a great honor for us, thinking that you are feeling that you could not be with us, that it's make enough, sir. Thank you so much, sir. I'd like to thank to our Honorable Vice Chancellor, sir, Professor Narayan Talukdar, sir, who has guided us in each and every aspect. We have many times went to him with the topics, with the subheadings, with the objectives. He have guided us what the right way to choose. Thank you so much, sir. I'd like to thank Professor Bandana Dutt, the Dean of Studies, Assam Downtown University. Madam has given us approval for organizing this conference. Madam is the first person who has encouraged us for this conference. Thank you, ma'am, once again. Without your support, this would not have been a successful one. Madam Gauriyashi Datta, Resident Trustee, Downtown Charity Trust, Assam Downtown University. Madam Gauriyashi Datta has supported us with her kind support. Thank you so much, ma'am. I'd like to offer my sincere thanks to Mr. Jyotisman Datta, Managing Trustee, Assam Downtown University, for giving us technical, for giving us all the supports from the university. Thank you so much. I would like to offer my sincere thanks to all our resource persons, Madam Lata Venkatesh, Madam Dr. Ratna Prakash, Professor Dr. Irene Feller, Dr. Mrs. B.V. Katyani, Madam Sridevi Balasandran, Dr. Rathi Balasandran, and Miss Patricia Vanderloop and Dr. Elsa Senna Tombi. I'd like to announce here, Madam Dr. Rathi Balasandran has suddenly fallen sick. She has expressed her inability to be with us during the conference, although previously she has committed to be with us. Madam has given her sincere apology, being such a big person. Madam, thank you so much. Today also, Madam has shared her blessings with me. Thank you so much. As Madam falls sick, so I have to look for another person now in a very short while. So, Madam, I offer my sincere thanks and from the bottom of my heart to Madam Dr. B.V. Katyani and Madam Dr. Elsa Sanatambi, who has taken my call at the last hour. They have accepted my request to be as a resource person to fill up the gap during the conference. I'm very much thankful to both of them. They are really a great hero, and both of them, they have shown that they are so much knowledgeable, even with the short period they could present so beautifully. Thanks to one and all the resource person. And also I'd like to offer my thanks to all the judges of the scientific papers, Madam Dr. Usao Khande, Dr. Lukima Sekia, Professor Punitha Lakshmi, and so on. And I'd like to offer my sincere thanks to all the organizing committee, Professor Nirmali Gogoi, Professor Manishi Sen Gupta, Dean Faculty of Nursing, and all the other faculties, moderators, and the scientific committee and the souvenir committee. So souvenir committee chairpersons Manika, who have Associate Professor Manika of Faculty of Nursing, who is working day and night with us. So thanks one and all, whosoever is involved with this conference. Thanks from the bottom of my heart. I would like to also offer my sincere thanks to the IT personnels and the graphic designing personnels. Without their support, this would not have been possible. So thanks one and all, and at last but not the least, most important, all the delegates. So all the 390 delegates, I appreciate all of you and I congratulate all of you, and I offer my gratitude to all of you for coming forward and registering for the conference. And during the conference, in the YouTube link as well as in the Zoom link, we have seen there was more than 80% of the people were attending the session. So we were analyzing, and it has been seen that 82% on average there was presence. So in spite of network disturbance, that much presence is a very much useful one. And I would like to take permission from all the resource persons to share the PPTs, whatever they have shared with us, to share with all the delegates. And we have the recordings of the conference. Very shortly we'll be sharing the recordings, and along with the certificate, souvenir also will be sending to each and every delegates and resource persons. Thank you so much. Thanks once again to the Assam Downtown University management, and long live Assam Downtown University. Thank you all.
Thank you so much, ma'am. And thank you everyone for your patient bearing with us and making this conference a great success one. The certificates and e-souvenir will be sent through the registered email that you have given during the registration. And if anybody has made any mistake during the email address, you kindly give the corrected one in the WhatsApp group that has been provided. Thank you so much. Have a nice day ahead.